How are we?
How are we today?
What's that?
You guys fill your bellies with some bread? Some stuffed bread? It was pretty good? Good breakfast?
Real good.
Awesome. How was last night? Any big winners here other than Neil? Harold, what'd you win? Oh, nice. Hopefully the Rockstar one, right? With all those energy drinks. That's all you need. Jake, you got that? Nice.
Yeah.
All right, guys. ACA today. And it says Nan Hartle will kick this off, but we've made a change to our EVP of sales here, Jeff Gaston, and he will kind of kick off today's ACA kickoff, so to speak. So give it up for Jeff.
Good morning, everyone. I'm glad that there's a lot of new faces in here. I think some people are a little tired after last night and decided to join us online. So, very excited to have everyone here. Obviously, there is a lot of things going on in ACA right now. There was an announcement late last night from the Senate Majority Leader that they expect in the first bill there will be no changes in ACA subsidies. So that'll be something that we'll update you later this afternoon on. Health Sherpa will talk a little bit about that as well. So we'll dive a little bit more into that, but it's almost an everyday changing atmosphere right now in the ACA world. Oh, is this one not working? Brian. Go from there. All right, guys, so as we start the ACA season, we've heard a lot of brokers saying that they expect to lose business this year. Let me be clear, that's simply not true. Oh, no, we're way off. There we go. All right, let me be clear, that's something that's simply not true. The opportunity is still here, bigger than ever, but if you're gonna go into this season with the mindset that you're gonna lose, you're already setting yourself up for failure. This year is the year that bad actors and fraudsters are going to be pushed out of the business and the industry. This means brokers who do things the right way, who are compliant, professional, and truly serve their clients are going to win. Success in ACA isn't about what's happening around you. It's about your mindset, your effort, and your ability to adapt. If you come in focused, driven, and determined, you're going to grow. We've built the tools, the technologies, the support for you to win. All you need to do is step up and seize the opportunity. So what that means right there is Health Sherpa is giving you all the tools that you need to succeed. SEPs are changing left and right. This year we've seen more movement since 2018 in a 6-month period. We haven't seen anything in 6 years that's gone on, and everything keeps changing. Loss of health coverage now, you're now having to show proof. Everyone's losing their mind about that, but hey, back in 2018 we had to upload documents, if a lot of you guys remember that. But there are SCPs right now that aren't being verified. It's always a changing, moving cycle. But the reason why this is going on, and then you guys see the 30-minute rule, we were on with CMS yesterday, every single person was complaining about it. The reason they're doing that is because of AI bots that are going through and auto-enrolling clients left and right. So when we say that this is the year that fraudsters are going to leave the industry, I promise you that is their focus that's going on. We've got to get them out so that we have good brokers and actors. ACA enrollment is 47 days away from right now. Those of you who don't know this, it starts November 1st. Obviously, Medicare starts earlier. But with ACA, it runs through the end of the year. It doesn't cut off on December 7th like it does for AEP for Medicare.
January 15th.
January 15th, thank you on that. But, so December 31st, though, is for your January 1st effective date. Anything into January is February 1st. Okay.
Isn't it December 15th for January 1st effective?
Yes.
Yes.
Okay.
I said that backwards. I was thinking Medicare now.
Jeff and I don't want to correct you, but...
No, I was thinking Medicare on that one, so thank you. All right, so ACA government subsidies, whether they'll be renewed this year, our opinion is yes. The reason for that is, you look at the swing states. You have North Carolina, Georgia, Florida, and Texas. Okay, the whole House is going to be decided out of those 4 states. Do you think that the Republicans want to piss off their voters and lose the House, and then they're dealing with impeachment hearings for the next 2 years of the last Trump administration. My opinion is no on that. But as of right now, I'm telling you it doesn't look great. As of the news yesterday, we now believe that it will be probably in one of the last bills of the year, and we're probably not going to be renewed till probably December at this point from the news yesterday. I'll get you questions at the end. So essentially what that means is if the news doesn't come in by September 19th, the government subsidies will be in there. All carriers have to file with subsidies being gone. So if that changes mid-year, you're going to see a price adjustment. My opinion as of this now is we are going to have a special election period in early spring if it does go through, because it'll be so late with it. So, but we need to be prepared. You know, obviously, if they don't go through, and then we have to deal with subsidies throughout the year, we will give you guys announcements, adjustments. All the carriers will be providing you guys with information on it. Health Sherpa does a great way of keeping you guys informed. They spend millions of dollars lobbying back in Washington, D.C., so make sure that you guys keep an eye out on their newsletters. Expect 20 to 30% increase in premium in 2026, okay? Utah, there's gonna be a couple carriers that are a little bit lower than that, because I know a lot of you guys are Utah brokers in this room. But across the country, you're gonna have 20 to 30%, and that's just gonna be the standard minimum. Florida, you're gonna see extremely high percentage increases. But I will tell you this, if carriers don't give price increases, they will not survive. You guys saw Aetna leave the market, and the worst thing that we can have happen, and trust me, like Ambetter, biggest, baddest carrier out there, you know, they have double the amount of enrollments till the next one. It is worse for them when Aetna leaves the business, because they have to inherit a block of business that they weren't planning on having. So carriers have to be smart. They have to add premiums in this year so that ACA lasts going into 2027. Okay, exciting things right here. We are one of the few FMOs in the country that is broadcasting growth in 2026. Everywhere I go, everyone is talking doomsday, like it's a nuclear war going on right now. They're going to lose 50 to 60% of their business. And my answer to them is because you have crap business. Most of your business is below $0. The clients do not exist. And you know what? Most of it's fraud. So you know what? I'm glad you're losing 50, 60% of your business. So good there. Next exciting thing, we are the #1 GEA slash FMO in the West. And that is because of you brokers in this room right here. This is very exciting news. We only started doing ACA at Agent Boost about a little over 3 years ago, and we've already grown to this number. We have more enrollments go through than anyone in the Western United States. And that is because of you guys in this room. So give yourself a round. So little things about Utah right here. We are the only FMO GA in Utah with direct national contracts in the state. There isn't a single FMO or GA that can say that. This gives our brokers a major upper hand in recruiting and positions all of our agents for growth, especially in expansion in 2027. The reason I say that is a lot of you are agency owners in this room. There's a lot of false narratives where people say, hey, I'm a GA, I'm an FMO. You guys are connected with us. You guys have a recruiting advantage. You can't go to one other place in Utah and have your contracts and actually have opportunities to make money as an agency owner right now. We are the only ones who are able to provide you that in the state of Utah. So use that as your recruiting tool for you to bring new agents in. Expansion in Utah. You heard me just say that on the last slide. We know of major changes coming in 2027. Everywhere I go with carrier rollouts, they all go, hey, we're looking forward to 2027. The year of 2026 is let's maintain. Everyone in this room, we're gonna grow, but we know of a couple big carriers that are looking at Utah, and one of them I've pretty much been confirmed is coming here, and we are very excited about it. I'm gonna give you guys some hints. Look at who's our major sponsors here today in Utah that don't have products. All right, exciting things. About 12% of all residents in Utah are on the marketplace. We are actually one of the highest enrollment states in the entire country. Heather's gonna speak a little bit about that later today, and a lot of that has to do with the brokers in this room. We have major amounts of business that comes in here just in Utah, and our brokers outside of Utah put a decent sized block here. Couple news for you guys. I'm gonna let you know right now, Molina is going off exchange in northern Utah right now. So this is Utah specific. St. George won't be affected, but those of you who do have Molina blocks, really pay attention to Select Health and University of Utah this afternoon. Short-term medical. We have to know short-term medical, okay? UH1 is going to take over right after me. Expect a 1-year short-term medical in the state of Utah. They can't technically talk about it yet, but they will probably have it by the end of this month. We can talk about it, but they can't yet just because of some legal reasons with it. They did send an email out yesterday kind of announcing it. But the reason we say short-term medical in the state of Utah is one of the cheapest options that you can have. If government subsidies do not get renewed, this is the option that you're going to have to look at. Those of you who do Medicare and the spouse is 64 or 63, I'd be looking at a short-term medical plan over an ACA plan all day, unless they are like barely bringing in any income and they're going to get government subsidies, but those might go away. Short-term medical is going to be your option. Heather is going to talk a little bit later today about commissions on it. You guys are going to be shocked on how much money you can make off of a short term. Allstate, obviously they have a 3-year, depending on the state, that you can do on it. Very, very easy underwriting with that as well. So, last but not least, any of the presentations that you guys see today, that you guys want, I see lots of phones yesterday and people taking pictures, we will send them to you. We are happy to send any presentation to you. If you want a carrier specific, if you want my presentation, anything like that, we will give that to you. So just email contracts@agentboost.com if you would like that. But while you're emailing contracts at Agent Boost, if there's any carriers in here that you guys want to be contracted with that you're not contracted with, we can get you contracted. With ACA, blackout dates are a little bit different, especially if you've never had a contract, we can get you in any time of the year. And sometimes I can ask really hard with the carriers and still get what you put in. So I'm going to pass the microphone now off to Tara with UH1. We're really excited to have her here, and she's going to talk about some of the plans that you can attach with ancillary.
Did you guys have fun last night at casino night?
Yeah.
I've never played craps before, and Jeff's like, oh, just come on over to the table with me. I'll teach you. Still don't know how to play, but I won a lot of money. And he said, if we were in Vegas, you probably just would have won me $10,000. He said, when we're at Medicarians in April, you're coming with me, but I just think you need to be with me.
She rolled 47 times without a 7.
Oh.
They were counting.
I guess that's good. What do they call it? Old red? You don't want old red? So it was pretty fun, but I didn't win any door prizes last night. So. Awesome. All right. So with that, you guys are going to have a lot of changes coming this year. I think a lot of you in here are new faces today. ACA, Medicare. This is where we come into play. I don't like to ride on the coattails of my fellow UHC people, but I think ancillary is going to be a really, really big part of your business this year. You know, maybe it's not something you've done before, but I think this is going to become a necessity for you guys moving forward. But it's going to be a lucrative necessity for you guys. So there's definitely opportunity with it. It isn't just me standing here saying you should go out and sell it, your clients need to have it. I think it's a bigger picture of understanding why do you guys want to sell it. We know not everything's covered by major medical plans or shared plans or group plans, whatever their major medical coverage is. Not everything is covered. So there is out-of-pocket exposure with that. ACA out-of-pockets are going up 45% in the last 10 years. 9,200 was an individual out-of-pocket for 2025. What's your client going to do if they miss work? They don't have an income coming in. These are things that can help supplement your clients with their daily living. And then last but not least is you guys in here. We know the cost to do business is continuing to increase every day, every week, every month. So this is a way for you guys to recoup revenue and try to keep yourselves as whole as possible through this change. So the answer's already up here, but would you guys have expected that 44% of Americans don't have money in their savings account to pay for an unexpected medical bill? Pretty fair statement, right? Which means 56% of people can't pay for that expense if it comes up. They're going to take out a loan, they're going to put it on a credit card, they're going to borrow from somebody, you know, whatever means they have. Medical debt is one of the largest reasons for bankruptcy in the US. This again is why we want you guys selling ancillary to help mitigate and alleviate those out-of-pocket exposures that your clients are going to have. Out of pocket for a family in 2025 was over $18,000. The average savings in a US household is only $5,000. I'm not a mathematician, but you guys do the math right here. This is another reason why we want you guys selling the ancillary to help your clients. I think having a better understanding and putting some numbers to it really kind of represents the relevance of this product. Almost 36,000 Americans hospitalized every year. For every 40 seconds, an American is having a heart attack or a stroke. 8,000 children a day visiting the ER because of an injury, a fall-related injury. And
The cost of their health insurance is causing them to have a heart attack.
Fair, that's fair, that's fair. Lifetime probability of men being diagnosed with invasive cancer is over 40%. These numbers right here, they worry me, and I have the different types of ancillary products that help in these different types of situations. So I think having a conversation with your clients and asking them these simple types of questions, you know, what is your income? Who do you know in your family that's had to go to the ER, or maybe they were diagnosed with a critical illness? Have you used your health plan? You know, what was your experience with it? I think having this kind of a needs analysis kind of conversation with your clients is going to help you guys kind of understand what your client needs and what you can put together for them. So can you see? Okay, all right. So United Health One has a very broad portfolio of ancillary products for you. Whether you're pre-65 or post-65, we can fit that need for you guys. This is a great chart because it's going to tell you what markets we serve with these products, and then if we have guarantee issue options for them. And as you can see, and I'll show a slide here in just a minute, I think we've got one of the biggest ancillary portfolios, really of all carriers, probably nationally. So when we come out with a product, I'm so impressed with our product team because anytime we launch a product, we do it where we have a very vast footprint. We have ancillary products in 49 states, just not New York. New York is very hard to deal with. The light blue states, so 3 states have less than 3 ancillary products, but all those dark blue states you see up here, so any of you selling nationally in here, we sell 3 or more ancillary products in those states. So Utah, we've got a very, very good product portfolio. So how many in here sell nationally? This is going to be really important for you guys, especially with this slide here, seeing all the products that we have and seeing how many products we have on a guarantee issue basis. So if you are dealing with the senior clients where medical concerns are a problem, guarantee issue is going to be a very good route for them. So we did a study of our own clients and asked them, when your agent sold you your policy, did they talk about other supplemental products? 51% of the time, they did not. Of the other 49% of the time that it was talked about and it was brought up, 67% of those people actually bought 2 or more policies, ancillary policies, okay? Which then equates to an increase in revenue for you guys. You guys are in this business to grow your business and to make money, not constantly chase business. These numbers right here are why we want you selling ancillary. In addition to protecting your client, you're protecting your livelihood. And then 78% increase in persistency. We are big advocates of EFT. I know Agent Boost is a big advocate of EFT as well. You're not chasing down expired credit cards, fraud on their credit cards, so EFT is going to be a really big push with us. Here's our portfolio. This just kind of gives you an idea of the different types of products. When we talk about dental, we've got a few different dental plans. No waiting periods, of course, guarantee issue. Critical illness, if anybody in here is also in the senior space, we do guarantee issue in pre and post 65. Hospital indemnity, pre and post, guarantee issue available. Vision, a variety of accident plans, and then we also serve a lot of different non-insurance products as well. But again, 49 states with ancillary products for you guys. and a portfolio of over 20 different products. So we know this year is going to be a lot of change. We know the enhanced subsidies from the American Rescue Act of 2021 are intended to go away at the end of the year. So I know this is Florida, but it's really just to kind of highlight to you guys what is the impact of what's going to happen when these enhanced subsidies go away. So a lot of information, but focused on the bottom left-hand side. Who in here has ever gone to the Kaiser Family Foundation website? They have an amazing calculator on their website where you can put in your family and their income, and it's going to tell you, okay, here's what your premium was with the enhanced subsidy on a silver and a bronze plan. Here's what it's going to go to when that enhanced subsidy goes away. So this family of 4, their premium on a silver plan with the enhanced subsidy to their savings to how they're going to be able to insure their family. So we talk about our ancillary plans. Again, we have a lot of products to try to fit the needs of most people. So we put together, and you can replace this Health Protector Guard, which is a fixed indemnity plan. I did this before we heard the news on short term. But a Health Protector Guard, which is our fixed indemnity, critical illness, accident, and dental, with a premium of about $685 a month, saving your clients 60% in premium, giving them first dollar benefits on hospital admission, critical illness, and accident. That is a way to close that gap for your clients and give them those first dollar benefits and some pretty big lump sum payments. And then an individual, just kind of giving scope to family versus individual. Same situation, you've got a silver plan going from 400 up to 500, not as big of an impact, still an overall 61% premium savings when we build kind of that same thing for your client. Now that premium on a Health Protector Guard plan, you replace that with a short-term plan, a 12-month plan in Utah, it might be less. And I will tell you, without telling you, there are going to be states where we will have 3-year plans. So again, if you guys are selling nationally in here, you're going to have an opportunity to not only sell a 12-month plan, but a 3-year plan as well. So stay tuned for communications from Agent Boost on that. But again, this is going to affect a large number of people. 44% average premium increases. This is a way for you guys to try to keep your clients as whole as possible by building them the best consumer protection package that you guys can try to do for them, given the state of your market. So just to kind of bring some visibility with the enhanced subsidies potentially changing at the end of the year. So again, do your clients a service and talk to them. I just talked to a gentleman this morning that said, I can't do business without United. Our portfolio that you guys have access to is probably one of the biggest reasons why he said that to me. So with that, I can't encourage it enough for you guys to make sure that you are selling. It is a win-win-win for everybody. You guys are going to grow your block of business. It's going to be a better book of business. You're going to make more money. Obviously for us, it helps our membership and helps our revenue. But I think the biggest thing is it closes that gap in coverage breaks for your client and lowers that out-of-pocket exposure that they will experience. You guys are giving them a greater overall protection package. So, why United Healthcare? I said it yesterday, I'll say it again today. Brand strength, I think, is probably one of the biggest things with us. Clients know United Healthcare. They know the name. Claims payment, I think we've got one of the fastest claims payments on our plans as far as time-wise and accuracy. Optionality, you guys have a ton of choices with us. A lot of flexibility when it comes to the products you can choose. Premiums, I know we're in a very cost-sensitive market, but we have a lot of products that you guys have the ability to kind of play around with to get to that price point that is feasible for your client. And then, you guys have myself as a direct contact with Agent Boost. We've got a great partnership. You guys couldn't be, tied up with one of the best FMO partners in the Western United States. So I wish you guys the best of luck as we come to this open enrollment period. There's a ton of opportunity. Chaos brings opportunity. Uncertainty brings opportunity. Take advantage of it. So with that, that would be that would be it.
All right, guys. So next we have Ed Shepard. As crazy as this is, he is actually located in Maryland, but we are kind
Virginia.
of Virginia.
I oversee Virginia,
Oh,
Maryland.
you oversee Maryland. Okay. So kind of crazy story about that. You guys do so much business on the East Coast with United Healthcare. Ed ended up being our account manager, which is really awesome because he is so responsive for anything that you guys need. We're expecting big numbers out of United Healthcare this coming year, and they are expanding more and more west, as you guys can see. Wyoming has been kind of a big player. There's some carriers that have left Wyoming, so we're expecting some big numbers out of UHC. We've already kind of been told in 2027 expect big county expansion. So with that, I'm going to pass it over to Ed Shepard.
Good morning. How's everybody doing?
Good.
Good? You awake? So, I don't know how much you all travel, but we travel a lot, and I know when it's travel season because I see your cup of coffee, right? I don't drink coffee. Hold up what you had right there. Yeah, that's my coffee now. Every day, it's a Monster drink, all right? So, yeah. So here's the deal. My name's Ed Shepard. I want you to understand my job is to make your job easier and help you make money. How many of you all, raise your hand if you're doing this for free? Anybody? No? Okay. Me neither. Okay, but what I want you to understand about what I'm saying here is I worry about you paying your bills, not me paying mine. Because here's the deal. If I can help you make money, we all make money. Okay? Here's another question. How many of you use Amazon? Raise your hand. Show of hands in the room. Who uses Amazon? Who has an Amazon Prime account? You don't even look at it anymore. You're just like, hey. It's like Christmas every day. And depending on where you live, you can order something at 12 at night and it shows up at your doorstep before you even wake up. Anybody had that experience yet?
Yes.
Isn't that ridiculous? That's crazy. Okay? Why do we love, and this is a question for you, raise your hand. Why do we love Amazon? Right. Where else can you open up an app, click one button, and have something show up within 8 hours? Okay? Now, the healthcare industry is not that. Okay? But what I want you to understand is that's what United Healthcare is striving to be. Okay? You heard Roger yesterday talk about ease, value, and guidance. Okay? And when we go through this presentation, I want you to kind of hear that. Where is it easy? Who is it easy for? Where is the value? What does it even mean, guidance? What's that, right? Does Amazon make suggestions for you? Oh, you bought this. Maybe you'll like that, okay? Same thing here. So what I'm going to do is I'm going to go through my agenda today, talk about our current market overview, the consumer experience, which we worked very hard on, product offerings, a little bit about our network, and then I'm going to close it out with operational enhancements for you all. Okay, so let's get started. Go ahead and jump into the market overview. Is ACA easy right now? No, it's kind of ridiculous, okay? It's literally trying to hit a moving target. And where that target was yesterday, to Jeff's point, already changed this morning, okay? And so in that ACA landscape of continual congressional CMS changes, it's not only hard for you all as the agencies, it's a challenge for us as carriers as well, okay? And so we're trying to pivot, change, wait, we got to resubmit this, so it's an ever-changing landscape, and we know that. But what we're trying to do with our strategy through this turbulence is make our products more competitive, and we do that by either improving or changing our products or our benefits where we need to, expanding where we can, And then also making incentives for our consumers relevant and easy. Okay, there's that word again. This is our current footprint. For 2026, we will not be expanding into any new states for 2026. However, there will be changes at counties within those states. So you'll see changes at the county level. Some additions, some subtractions. I had a conversation with the Tylers, all right? OG and OT. Basically, a lot of times, if we're going in or coming out of counties, it's probably because of network negotiations, okay? Also, new product. Wait, you said you didn't have any new. It's kind of new. We're going to have mirrored plans without pediatric dental. We know that not everybody has children, and so wherever we can and where it makes sense, we're removing that pediatric dental to also lower that overall premium for the consumer. HSA plans, all on-exchange bronze plans are now HSA eligible, so you will see that as well. That's not just for us, that's for all carriers. Off-exchange is going to be a big play for us this year. We know that ICHRA is like the buzzword, and there's a little bit of a gain in momentum overall. And so what we want to do is we want to make sure that we are positioned well if it actually does catch fire. I think that's what the younger kids say. We want to make sure that we're there. For 2025, we only offered off-exchange plans in 7 states. We'll now have off-exchange plans in 17 additional states. We will have an expanded portfolio in Wisconsin of off-exchange offerings. The other 16 will have silver on exchange only. And then you see Georgia. Anybody do business in Georgia? Fantastic. Have I got a product for you? Okay. We will have standalone broad choice plans in Georgia, statewide. Okay? And so write that down. Statewide off-exchange only in Georgia. Okay? Why are you doing that? Well, that's a great question. I'm glad you asked. So, again, we want to make sure that we are positioned if ICHRA actually does start ramping up like some of the market says it will. Okay? And so what we're doing is we're taking our off-exchange offerings and we're also moving into a different network, and we're moving that statewide. Okay, it's a focused product off exchange, and what's going to happen is we've seen 30% growth year over year in the ICHRA space. It's not a lot, but it's enough for people to stand up and pay attention. So we will go to the broad choice network. Anybody do group business? That's the choice network. It's separate from the individual and family plan, so it's a totally separate network. Off exchange, we'll have two bronze, 4 silver, and 2 gold. Okay? The goal here is to offer that choice network in Georgia where it's competitive, take our learnings, and then expand this opportunity in the future in additional states. Okay? Anybody familiar with value-based care? All right, thank you, sir, in the back, for raising your hand. So value-based care is a very narrow play, and we started this with Kelsey Siebold in Houston in Texas, okay? This is something I'll explain here in a second. So we started that in 2024. We're going on year 3. It's been wildly successful at the local area, and for 2026, we're going to go into one big old county in San Antonio with another value-based care with Sanitas. So if you do sell in Texas, which I think pretty much everybody does, you may see plans pop up, and that's what those are. They're value-based care plans. If you haven't heard that before, what value-based care is, it's a very tight-knit partnership with a specific provider, and the goal here is to kind of cost savings, right? So rather than quantity of service, we're looking to manage those costs through quality of service and outcomes, okay? And so that's what those are. And it's, the opportunity is it's brick and mortar with one payer, United Healthcare, and only exclusive to individual and family plans. All right? If you want to know more, let me know. Here is, if you got your cameras, you can take a picture of this so that you know. This is our 2026 footprint with the states at the top with no changes. Georgia, we've already talked about. The on-exchange footprint for Georgia will not change. However, off-exchange, where will we be? Anyone? Oh, come on. Statewide. We'll be statewide in Georgia, okay? Off-exchange only. Footprint changes for 2026, positives and negatives. Those are the counties that you see there. We're not going in Utah just yet, okay? Sorry. All right, I want to focus on the consumer experience for just a second. When you all sell United Healthcare and they have a not so happy experience, who do they call? You. They don't call me, they call you. You are the first point of contact. And so if they're unhappy with United Healthcare, they're probably also actually unhappy with you, the first point of contact. And we want to continue to work on that so that it is easier, and it also gives guidance to help that customer through their experience, okay? How are we doing that? Well, the first thing that we're going to be doing is we're going to be focusing on that digital experience. Raise your hand if you don't have a cell phone. Okay. Raise your hand if you haven't video chatted or had a video conference or FaceTime somebody on your cell phone. Okay. Again, there's like 3 people. Everybody is in the digital space now, and because of that, we're also investing heavily within that digital space. How are we doing that? Well, we're going to start by focusing on the UH1, the MyUHC app. Okay, I use it myself. Okay, we're going to start by allowing customers that are already with United Healthcare to have a renewal process, a renewal experience within that app already. We'll send them notifications, hey, here's what your plan is, here's what possible changes. It'll all be in that MyUHC app. Of course, somebody's calling me. Oh, Dapo. Of course he is. Okay, right? But then the other thing that we're doing that's different this year, so share this with your customers. They will now have pre-effective access to the MyUHC app. What does that mean? That means if you enroll them in a plan in December, they will have access to it once that plan gets effectuated, so they can get set up. They can go see what their benefits are, their rewards. They'll be able to see all of that before January 1st once the benefits kick in. Okay? That's new, and we're pretty excited about that. Other thing that's really a big deal is the provider search. Really? Yeah, it is kind of a big deal. The MyUHC app, we now have worked to try to make that a very similar experience to what they would have on the web-based platform. Meaning that they can go out and search doctors, yeah, but they can do side-by-side comparisons. They can actually select different things. They can also even, inaccurate provider information, you ever get that? Okay, they can actually submit inaccurate provider information. I called that doctor and he said he wasn't in network. Bing, hit him up right there in the app, all in one place. The other thing that I want to, I don't know, anybody see this right here, this little green area? Yeah. Smart Choice. We've embedded AI in order to help with that experience based on other selectors that that customer has chosen. So what that does is if they only want male and they want somebody within this, it's designed to give them a better provider experience with us as well. And the question that I got before is, well, Ed, why is this dude a 3.7 and he's 97% Smart Choice? Okay, because it doesn't just take the thumbs up or thumbs down that we're used to with other apps. It also takes into consideration our relationship with the provider as well as cost. Okay, so just know that's what we're working on. Other thing, referrals and prior authorizations will be able to be seen within that app. That's a big deal. If a customer is looking at a provider and they select them, they will be notified that a referral is required. Okay? Prior authorization, same thing. If they are going to their PCP, prior authorization is required. That prior authorization will be submitted, and then they will get a notification that it has been submitted but they will also be notified if it was approved or denied, and then next best steps. That's pretty cool. Claims and documents that we have in there, also EOB, COCs, any other invoices, they will be able to see those in the document center within the app. Pharmacy is something that we've also really focused on. This is utilized by more than 60% of the customers, okay, that use the MyUHC app. They use this feature because they can pull it out, search whatever. Previously, the experience was discombobulated, to say the least. What we've done now is we have created a dedicated RX landing page within that app so that everything shows up. They click that RX, everything is within that one landing page so that they can search for pharmacy. They can search for their RX. They can select all kinds of different things. Oh, that one requires a prior authorization. Let me see where we are with that. All of that is in a single dedicated landing page. And they also like to save money, so there's also an area where they can have a savings center that will help them see what they're paying, where they could have saved money, what we're paying in addition to that. All of that is within that savings center to help them save money, okay? Last thing we're doing is health perks. Our healthy rewards is going from $150 to $250 this year. I'll speak to that in a second. They can do that on the app. They can see what rewards they're eligible for, which ones are ready to redeem, and then they can even redeem it within the app to get that submitted to them. So that's pretty cool. Last thing is some of your needier customers need resources. They will now have access to a community resources page. I had to put it on the web version so you could see it. What this is this will give them a resource page where they can find things that they need at the local level. They can go out and look for resources for financial assistance, housing, transportation, and so much more. They can even self-refer. So if I look at something, I'm like, okay, I need financial assistance, I can self-refer myself in to that local organization so that they can reach out to me, okay? Cool? All right, product strategy. No new products, there's a mirror plan, I already mentioned that. Essential, we will now have that on exchange. Previously, that was only off exchange in select markets. We will now have the essential plans on exchange in most markets. If you have customers that are low utilizers, this is probably going to be one of the best products that you want to put in that plan selector, right? Plan comparison tool, so that you can compare based on what their needs are. Okay, bronze essential. Required, you know what those are. Value is what it says. Copay Focus has been a huge success. That represents, last time I checked, 47% of our entire book of business. That plan's only been around for 2 years with us. And so it's wildly successful, $0 deductible, okay? So these plans have a $0 deductible. A lot of the benefits are also copay, so that there's price transparency. They know exactly what they're gonna pay as soon as they go, all right? Very popular. Let's talk about value for a second. Okay, black this out. When we're talking about value, a lot of times what I hear is this: Ed, why are your plans so damn expensive? Right? Okay, here's why. I bought my wife a car 3 years ago. It's the Platinum, okay, right? I want to make sure she's safe. That thing has crap on it that she will never ever know how to use, or hopefully, God willing, never need to use. All right? How many of you need to know that you have side impact airbags? All right, you really only need to know one time. Okay? Hopefully you won't, but that's value within the car that you drive. Our plans are the same. We have benefits in there for your customers so that when they need it, when they have that challenge, it's there for them. And that's what we're there for. Okay? So $0 medications. Oh, well, I don't need this. Okay, you're right. However, what if they have heart conditions? What if they have asthma, mental health? If they have challenges, these are already embedded into all of the plans. So when you're doing your needs assessment and you come across somebody with one of these, this will be something that you want to take a look at. Okay? Sometimes the cheapest plan is not always the best plan. It might be on premium. However, if they have to utilize that plan, it can be more expensive. Okay, so pay attention on the needs assessment of what your customers' needs are. The other thing is if you come across customers with diabetes, this is not one plan, this is all plans currently. We have $0 diabetes. We started this in 2024. We added more value in 25. And for this year, we have pharmacy provided supplies, right? That DMA, durable medical. We have some of those embedded into the plans as well as oral medications for 26. Now, make sure you check the formulary. Don't assume that, oh yeah, you got $0 everything. No, it's still specific products within that category. So check the formulary to make sure you see which ones actually qualify. I will be able to provide a list once that becomes official to roll that out. So if you have customers that have diabetes, you can see which ones qualify or even have that conversation to see if you can switch them into those $0 medications. I already mentioned this, $250, right? Free money. Check this out. Imagine you have a customer that is on our plan, $0 PCP visit. They go, we just paid them $150 to go to the doctor. That's pretty cool, okay? That's one part. The other is $50 for account-related actions. That is available in every state except for New Jersey, okay? They don't allow it. And then new this year, how many of you all do Medicare? How many of you are familiar with HRA? I actually saw you all, a couple of you cringe. You're like, ugh. All right, I remember when HRAs came out, it was a pain, okay? This they can do within their My UHC app, by the way. And then once they submit that HRA survey, they will now get an additional $50. The way this works, if you're not familiar, for each of the rewards that they qualify for, they do it. Once they, once they've done it, they would then have the redemption available on the My UHC app. They submit the redemption. Visa gift card will come to them in the mail to their home address. If you already have United Healthcare customers on the plan, right, and they've already created their account options, they'll have $50 waiting for them on January 1st to redeem. But then once they do these in 2026, it'll just reload that Visa gift card. Well, what happens if they lose it? All member services will get figured out, okay? Yeah, I see you laughing. You were thinking it. Okay. Vision benefits. We have pediatric vision on all plans where allowed. Plus plans have adult vision. Hasn't changed for as long as we've offered these plans. It's still pretty much the same except for $150 in frames. Anybody buy glasses lately? Man, they ain't cheap, okay? And so we did increase that last year. That continues. $25 copay for in-formulary contact lenses as well, all right? And then $0 eye exams. Plus plans, adult vision. Also on plus plans, we have adult dental, and we have pediatric dental embedded in plans where it's allowed as well, except for Washington. And the way that works is right there. South Carolina and Florida are currently the two that will not have pediatric dental to make them cheaper. The adult dental, $0 on exams, $1,000 max out-of-pocket benefit with 50% co-insurance on whatever is selected, okay? Virtual care, we have virtual care through Amwell and Doctor on Demand. The way that works is they can go to the My UHC app, go to the vendor site, select it, and actually have a virtual visit. Anybody ever do a virtual visit? Right? Let me tell you what, if you have kids, I'm going to give you an example. You wake up at 2 a.m. in the morning with a 3-year-old crying with a fever. How you know this, Ed? It happened. Okay? And so 3 a.m., what's the only doctor that you can go to? Emergency room. Okay, now you've got to get your whole family dressed. That's a pain, crying baby. Now you got to get them in the car and drive them to the emergency room. Now you got to sit next to the drunk guy that tripped off the curb for 3 hours for a fever. You're laughing, but it happens, okay? Flip it. Virtual. Fever. Get them on right there in your pajamas in the living room. Hey, he's got a fever. What can we do? Da, 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 whatever. Check your symptoms. Okay, here's a prescription. Go to your 24-hour. Done. Okay? So this is a great value. We also offer virtual PCP through Galileo. The way that works is when you select a customer PCP, you don't select a brick and mortar, you would select Galileo as that PCP option. Fitness benefit is free to 18-year-old digital experience. Then we have 4 buy-up options for in-person gym membership. I do have additional benefits. They aren't totally like rolled out for 26, but as soon as I have it, you'll have it. 4 different levels. If a customer buys up into in-person, they also get shipping options with Walmart and Shipped. Not something on your shoe, it's a shipping option. And then AARP memberships as well are also submitted in there. Walgreens discount is big. Do we have Walgreens in Utah?
Yeah.
Okay. This will make you an agent superhero with United Healthcare. Make sure this is highly utilized. Walgreens 20% discount. Okay, they'll get a card, they go in, they buy the things that even says OTC benefit. Okay, you pull those off, give them the card at the point of sale, they get 20%. It's not one day, this day only, it's every day. Okay. If you have questions about specific states or you want highlights for the network or the states, you can scan the QR code here, or I also have it at the IFP booth, so make sure you go look at that. Contacts, that's me, you don't need that. Okay? All right, I've already talked about the customer. Now I want to talk about what we're doing for you. Late payment notifications. You will now see if we call a customer, because you know a carrier will reach out to your clients, right? If we call your customers or we send them late payment notifications, they're going to call you. I got this notification, and you don't even know what they're talking about. Well, now you can go to your book of business, go to that members portal, and you can literally see what we sent and how we sent it. Okay? Now, what else is cool is Agent Boost will also have it at the agency level to help manage that so that we have consistency. So that's kind of cool. The other thing is if with your members, you can actually select ICHRA now. Anybody here actively selling ICHRA? Okay, not a big deal. But if you do, you can actually select those as an ICHRA member, so you can actually tease them out of your book of business. Okay? We have enhancement tools in Jarvis. We have agent trainings, but we do those for y'all. You're good. And we also have summary of benefits and the coordinations of care in Jarvis. So when you have to have specifics for a plan and you don't know where the crap to go, it's now in Jarvis. So you can download that 180 whatever page document and search, okay? Interactive benefit grids. This is something where, all right, you represent multiple products, multiple carriers, multiple websites. How many of you have an Excel file just with all these stupid websites? Right? Okay, well, we're creating state interactive benefit grids where everything that you need is in one place. Everything. Summary of benefits, plan name. We're even attempting to make it where it's an unsubsidized premium pricing, so you can even price our products so you can see which one is even the cheapest for that particular customer. Well, what if they're a family? That's okay. There's going to be a tab for that, so you can even price out a family unsubsidized. Okay? It's coming. Just be patient. All these changes with CMS, we keep changing our premiums. Okay. The other thing is Broker Compass. If you have a customer that reaches out to you with a specific need and you're not really sure, there's now going to be a guidance tool for you. Education materials as well as all sales materials, they're now in one area, and then based on need, you can select that tab. 39% of individual and family plan customers don't, only 39% realize that enhanced subsidies might go away or there's other changes. That means that there's 61% that have no clue. All right, and with that, part of what we're doing as a carrier, and I want you to understand this, is we're doing proactive outreach to those consumers. Hey, this is going to change. Hey, did you know about this? Hey, make sure you're aware of this. Make sure you speak to your agent broker about whatever, okay? Because we want to make sure that we have them prepared. When you get to November 1st, you're still going to have that one customer that you've had for 6 years, and they say, well, I didn't know this was changing. Well, yeah, okay. But like, we're trying our best to help you help them, okay? But we're not just helping them, we're also trying to help you. what we have is we have it on Jarvis, once it's gone through legal, right? This will be out there. It's an FAQ for you, so that when there's specific questions about this or that from all of the rule changes, we have something out there that you can speak to it. This is what the consumer needs to know. This is how you can frame it, okay? And last thing, I promise, am I going too long? All right.
No, you're good.
Good. Producer help desk. Anybody use it? All right. If you have a bad experience, let me know. Okay. Again, my job is to make your job easier. And if you're getting crappy service for them, you tell me, and then we'll call that a training opportunity. Okay. If you get bad, if you get bad information, let me know. That's not okay. All right. The other thing is this. If you're on the phone with a customer and they ask you a question you don't know, does anybody use the producer help desk chat feature? Yeah. Use it, because I think y'all call it ghosting. Kids call it ghosting. You get somebody, you have them on the phone, they ask you a question you don't know. Oh, I don't know, let me find out, I'll call you back. You get your information, nothing. All right? Well, with a chat, you can actually chat in real time to get your question answered while you still have that consumer on the phone. Okay? All right. That's it. Any questions, comments? Yes, we do pay commissions. Okay. What question do you have?
On the virtual PCP.
Yes.
Is that kind of just PCP by committee, or do they always get the same document?
Okay, so that's a great question. Virtual PCP, how does that work? If I go to my PCP's office, how many times do you think I get to see him in a year? Right? It's whoever's there. It's my same thing with Galileo. You're selecting Galileo as the virtual PCP, and then they will get whoever is in rotation at that time. Great question. Thank you. All right? We good?
Good.
All right. Awesome.
Uh-oh. Battery's dying on this.
Hey, you're loud, you yell.
All right.
We're going to go to a break. We're having a quick change. We're going to break now. We're probably about a 15-minute, ahead of schedule. We're trying to get you out of here sooner than later. So also, we had a flight change with Tara Bloss, our UH1 rep. And if you need any information from her at all, please go see her now before she has to leave and grab a flight. So we can meet in about 15 minutes.
Be back at 10:20.
20 minutes.
20. That way we can get an extended lunch, and we'll get you guys out of here about a half hour early. Off the bottom.
So like I said, we are trying to keep you guys ahead of schedule to get you out of here. It is a weekday, it's a selling day, and I'm itching to get back to work as well. So we have Heather Woody. She will be talking about changes in the ACA market and then kind of touching on commissions as well. You guys, is it kind of cold in here, or is it just me? We had a couple requests rather than the hoodies for next year to do Snuggies.
Yeah.
Right? So I'll have a lot of hooded individuals out there.
Can we put with your face on, Pete?
No, that's not going to happen. All right. Guys, give it up for Heather Woody.
So Jeff alluded to this. I'm going to go a little bit deeper about the chaos that's going on in the market. Literally, you guys, it is a day-to-day, almost an hour-by-hour update that we're getting as we're going. We were on a CMS call yesterday, heard some changes. CMS call it saying, hey, this is what we're going to start tracking, different things like that. So let's talk, first of all, the program integrity rule. So the program integrity rule was announced in June. They said it was going to happen. Then some things happened with the courts, and it's now in a stay. So there's some things that are coming, some things that are happening. There was updating news as far as catastrophic plans. So here in Utah, we don't necessarily have catastrophic plans, but there's a lot of states that do have them, and there's some updates on how those are going to work as far as getting the exceptions. So the whole goal of the program integrity rule was to create more stability in the market. More stability in the market, and the hope was also to decrease premiums. It's not happening this year. They are saying that it's going to probably happen in 2027. We'll see a little bit more stability. It's also going to reduce the fraud. It already has, you guys. We've watched it over this last year. We saw it decrease in June. We saw it decrease in July. Then August, we saw it like boom, drop off almost. Exactly.
What was that? What was that noise that did that? Yeah, okay, thank you.
It's also going to improve the eligibility verification process for SUPs and for plan eligibility as well. So some of the final rule provisions that are going to happen come 2027. Jeff already indicated this, so for 2026, open enrollment runs from November 1st through December 15th. And then continues on through January 15th for a February 1st effective date. Come 2027, that's changing. It is done December 15th. No options going forward. The state-based marketplaces also have to follow a similar guideline. They can set the dates. A lot of the states are coming back with some of the dates, but they haven't announced what they're going to be because it doesn't have to happen until 2027. Sunset of the extended advanced premium tax credits. So I've heard a lot of agents in the market scared about premium tax credits going away. They're not going away. It's the COVID era extended subsidies. The years of having a zero premium for people who have that real low income, it's not going to happen, at least right now. That's what we think is probably going to happen. Like Jeff mentioned this morning, it's a day-by-day, hourly-by-hourly thing right now. The monthly SEP for those people with low income, that's where we saw the huge drop-off. That's gone, never to come back again. Congress has codified it where you cannot include anything with income for an SEP. So that 150% federal poverty level is gone.
Doesn't it come back in 2027, but there'll be no...
It does not. It does not. They, with the program integrity rule, they thought it was going to come back, but in the, they're calling it OB3.
Good to know.
big, beautiful bill. They codified it and said, nope, not happening. So the final rule, as I mentioned, was published in 2025, June of 2025. August of 2025, some of those things were supposed to start taking place. August 22nd, right before everything would start to take place, there was a stay that was issued by a court out of Maryland that said that certain parts of the federal program integrity rule could not be implemented because they did not have the authority to do that. A lot of these provisions are sunset by 2026. So what was put in the stay? This is really important for you guys. So the first thing that was put on the stay was the verification rules for SEPs. All SEPs were going to have to be verified starting August of 2025. That's not the case. The only one that requires a verification currently is loss of minimum essential coverage. All the other SEPs are stayed with the verification rule. So you still have Medicaid, you still have incarceration, you still have MOVE, you still have a lot of SEPs that you can still utilize to help people get coverage. The other thing that it blocked is the adjustments to what they call the actuarial value of plans. So what that means, carriers had already filed all of their plans. All of their plans were filed, coming with the expectation that they could have wider ranges of actuarial values. So what that means is your bronze plans could have a lower actuarial value than what a bronze plan would normally have. Silver could have a lower actuarial value. I'll show you guys on the Anthem presentation exactly how that looks. So here's what's happening. If nothing happens on the court ruling by September 19th, carriers in many states are going to have to refile their plans. September 19th. When's open enrollment? November. So what you're going to see from a lot of the national carriers, especially today, from our national partners, I want you to give them grace. Because they are going into this, we're not going to know commission rates because of this. We're not going to know what premiums are going to look like necessarily. We're not going to know what plans even really look like until probably October. Because they have to be given an opportunity to refile their plans. If you guys will hang on to your questions, when I get done, Jeff's going to come up and we're going to kind of field questions. So hang on to your questions, if you will. So until the stay is lifted, none of the provisions can be implemented. So here are the things, let's see, okay. So the $5 premium. If you auto-enrolled a policy that had a zero premium, if the extended subsidies happen, we will still see zero premium. If the plan was auto-renewed, it was automatically going to go to a $5 premium. Not now. That's actually stayed by the court. They cannot do that. The enhanced verification checks, also currently in a stay. They cannot enforce that currently. And as I mentioned, the carriers now, I thought it was they can file, they may have to refile because of those actuarial value differences. Yesterday on our phone call with CMS, they informed us that they are going to start tracking agents and agencies. We are very lucky to be one of the largest agencies across the nation, and so we meet with CMS on a monthly basis. As part of that, they are also going to start tracking agents and agencies that they are aligned with. What are they going to start tracking? So this is why I want you guys to be aware of what CMS is tracking, because they're going to hold us accountable and they're going to also hold you accountable. So what happened over the last couple of years, you saw a lot of fraudsters, a lot of people using what they call NPN override. Anyone know what NPN override is? So basically what was happening is you had a principal agent who owned an agency who would say, hey, come work with me because I can give you a higher commission rate, because they would stack their policies and they would then get bonused based on the policies. They also got more pull with the carriers, more pull with CMS. So what's happening now is many of the states are saying, no, you can't do that. Currently, I believe there's 8 states. You do business in Texas, no, not Texas yet, Florida, South Carolina, trying to remember all there's a handful of states. Iowa, Wisconsin, several of the states have said, we at the state level are not going to allow you to NPN stack. United Healthcare, if you're doing business with United Healthcare in any state, you have to use your own NPN, which those of you who've done business in the Medicare space, it makes sense. It makes it easier to track agent fraud behavior. So CMS is now tracking this also at the NPN level and allowing us to know what's going on with our agents and agencies so that we can see that. One of the other things that they are tracking is how often you're using that loss of Medicaid and not able to prove that they've lost that Medicaid. They're tracking that. Any kind of citizenship or immigration. So if there's somebody who doesn't have a social security number, they're here legally, different things like that. If you don't resolve that, they're tracking that. Income matching. So if you're inflating somebody's income to be able to get them to subsidy. I heard from CMS's mouth last week. Do not use the phrase, do you think you can make X amount or more? So be cautious with inflating people's incomes. If they don't think they can make enough, if there's a catastrophic plan, put them on a catastrophic plan. If they can't afford it, find a way. Find a way to help them make more money. Also tweak your marketing so you're marketing to the right kind of people. So if you do have questions about your marketing partners, I will just tell you this much. They are also watching very carefully marketing partners. So if you have any questions about who you're buying leads from, who you're getting things from, I would strongly, strongly encourage you to talk to AJ, Aaron, here in our office. We've got some really strong lead partnerships, as well as some things that are going to be moving forward that are going to make it so that you can protect yourself, not have to worry about this. The last one is the non-verified SEP consumers, people who are enrolled in both Medicaid and a full marketplace plan. They're monitoring that. And then they're also looking to see active versus passive renewals. So make sure that you're doing your best to actively renew your book. So that means talking to your consumers, talking to that information. So I am asking you as an agency, we love being known as one of the good guys and one of the people who are leading the industry. We are known as that, both by CMS and the carriers. Please help us maintain that integrity. If you ever have questions, reach out to myself or Jeff, and we're happy to help guide you to know how to do things. So what's your opportunity? I've talked about all the chaos. I've talked about all the information. Ed alluded to it this morning. Most consumers really don't know what's going on. And I'll be frank with you. I hear from agents almost on a daily basis. I didn't know that was the case. When did the 150% federal poverty go away? When did that happen? When did this happen? You need to be, as an agent, very aware of what's going on. If you're not plugged in, you should be. We're doing trainings almost on a weekly, monthly basis. You need to be plugging into those trainings to make sure you know what's going on in the industry. There's a lot of call centers closing. I have a partnership with another agency that has employees that worked for a very large call center out of Florida, had 100,000 lives. And how many of those were fraud? We don't know. But 100,000 lives, they shut their doors. About 70 to 80% of all enrollments on the marketplace happen through agents. So as Jeff alluded to this morning, if you think your book is going to shrink, there are a lot less agents in the industry now. A lot less agents who are actually going to be doing business. It's a big opportunity. If you're not doing business outside of Utah, you should be. You should be. Utah is, I believe, last year #4 in the nation for agent-assisted enrollments, but there are 3 states ahead of that. So you should be doing business outside of Utah as well. So if you don't know how to do that, please reach out and we'll be happy to help you with that. The court stays have created a lot of chaos for agents and for consumers to know what's really going on. And the last thing is just the shorter enrollment period. This year it's a little bit longer. Next year it's going to be real short. So you're going to need to be very nimble and very quick. We always like to talk money. A Medicare commission for a renewal, $347 next year. That's for a single person. If you write an ACA, and this is on the lower end of things, $20 is the average. There are some states that are as high as $25 or $30 per person per month, up to 5 members. You can be making about, with the retention bonus, which we don't know necessarily what's happening with that. We've heard from a lot of carriers that retention bonuses are probably more likely than new member bonuses. You could be making about $1,400 in the same amount of time or less. I would argue less time on ACA. We have a lot of really good agency partners who are making a lot of money on ACA. So if you're not doing it, you should be. We talked about the premium increases. So last year, there were a lot more carriers in the market. This year, going into it, we've got about 312 carriers nationwide. The average increase is about 18%. And as far as the range of premium increases, we have some decreasing premium by 10%, some as high as almost 60% increase. So definitely need to stay abreast and make sure you're communicating with your consumers right now. Talk to your people right now. There are only 4 carriers that are proposing a decrease this year. Last year there were a lot more. The number of carriers that are increasing their premium, almost 250 nationwide who are increasing their premiums. If you want to know where to go, here's your top states for ACA. The dark blue, you'll see it's down in the Panhandle. This is where you're going to see a lot of people and a lot of enrollment. And this one was growth as well. Huge growth. Here's where you can do the FFM training, which, by the way, has not been released for 2026. We were told yesterday on the CMS phone call, very soon. Very soon. Yeah. Keep an eye on your emails, because just like we did last year, we will plan on doing a training. When you can come, we'll help you get through the FFM training. Maximum out-of-pockets are increasing. So this year, it was like $9,200. Next year, it's going to $10,600 for an individual, and $21,200 for families. That's big. That's a big jump. Yes. HSA qualified contributions, so they can contribute to an HSA. One thing I will mention that is good for those families who can afford to contribute, bronze plans, all bronze plans and expanded bronze plans are eligible to contribute to an HSA this year. That was also a change. So it's going to be a big change, especially here in the Utah market. The Utah market, we write a lot of bronze. The group affordability. So that family glitch percentage is going up. 9.96% of their income. If they can't afford it, they can go on the marketplace and get subsidy. It's also going to be critical. Tara already talked about it this morning. It's going to be critical for you to be bundling other products with their plan. It's not going to be something where it's going to be an option. You're going to need to do that. This is telling you where, so pre-COVID, the subsidy cliff was at 400% of federal poverty. That's coming back. And we don't anticipate that to come back. We might see the zero premiums, but we don't know. So if you're looking at this from a family of 4, if they're making $128,000, if they're, I mean, it's not a lot of money, but it's a good share of people who are going to be losing those subsidies. And it's going from a graduated cliff to a cliff. It's happening. So what do you do with those people?
That's it.
What do you do with them? I'm going to encourage you to multiply your revenue. This is a 3-year short-term policy that I ran with Allstate yesterday. This is a husband and a wife and a single child, 30 to 35. It's even bigger savings if you go higher than that. The nice thing about short-term, this right here is looking at it, and you're looking at this commission would be about $893 annually, and it's renewable for 3 years. Guaranteed premium for 3 years. You think increases look ugly this year? Just keep watching. Then you attach an accident policy to it. An accident policy would take care of this deductible amount. It's about $20 a family. It's not that expensive. You can attach it to your ACA plans. You can attach it to your short-term plans. You can attach it to anything. You can write it standalone. If you're not writing accident policies with Allstate, you should be. They're very affordable, they're guaranteed issue, and they're great commissions. 183 commission on this one. The dental, another 383. So I told you on the low end, you're looking 1,400 commission if we have bonuses. If we don't have bonuses, it's going to be less than that. This commission would be about $1,450 on an annual basis. Can you hang on to your questions real quick? I promise at the end of this. Even more important than what happens to your revenue is you do see a 121% increase by cross-selling. This is an UH1 example of commissions, the difference between an ACA and attaching to your plans. So let's talk for a minute about carriers here in Utah. I know a lot of you guys are Utah brokers, and then we'll talk about. Here in Utah, you've got 4 options, mostly in northern Utah. You're going to focus on Select Health and U of U. Imperial does have a couple plans in a couple areas, but their network is pretty limited. Molina is going off marketplace in northern Utah. Only available written by paper application. So Imperial does use the multi-plan network, so you're going to have access to them. Here's the Molina piece. This is Imperial. They are only available in Salt Lake and Utah counties. Here's their hospital network. They do have UView. So what are we doing for you at Agent Boost? I had previewed a form that another company has developed on the Go High level, which is what we use, on the same system that we utilize. So what we have done is we have developed a form that you can go utilize with your consumers so you can start sending things out and getting their renewal information now. Talking to them about what's changed. Has your family composition changed? Has your income changed? What's changed over the course of the year? It will then, you'll be able to direct them to Health Sherpa. They can also set up an appointment with you, by the way, to schedule a time to talk to you about their plan if they want to. It will also have campaigns where they can just respond and say, I like my plan, keep my plan. So I'm working on developing those. We do have also a form for your new consumers. So during open enrollment, there's gonna be a lot of noise. You're going to have to focus on making sure that you're getting that information and being very efficient. So all of that will be developed. The forms are already developed. I will be putting them into options for you guys. If you want those, I need to know quickly so that Nico can develop them for you specifically. So if you need those, please reach out to me. The company that I mentioned before that I found these forms from charges you $250 a month to have access to their system. We do that completely free of charge for you. Do you want to come up now or you want to wait till?
We do it now.
Okay. And have Jeff come up and we'll talk, answer questions before I move on to the other carrier information. Yeah, Jeff.
So, you know, every year, especially like Select Health, they send out a good letter that says this is what your plan will be next year, and here's your next year premium. And a lot of the time they put in what your estimated subsidy is going to be, because they don't know by the middle of October when they print those letters. With what you're saying about all of the stuff going on, I'm assuming that whatever that letter is, other than this is how you check your application and renew, we really can't count on the numbers in it.
I've never counted on those numbers, and I would communicate with your consumers ahead of time saying, look, you're gonna get a letter. It's based on this year's subsidies. We don't know what next year's subsidy is gonna look like. So that's why I'm telling you now, you need to be communicating with your consumers, and if you're not, you need to be.
More questions?
More questions?
So on there, on the commissions, it shows first year, is the second year like 95% less, like some of the supplement programs?
Are you asking on ancillary
On short
products?
terms?
Yeah.
Yes, we can give you a breakdown and it'll give you an exact amount per year onto it. UH1 hasn't come out with their short-term medical commissions on it yet. All states, I believe it is level for all 3 years.
Level, okay.
It is level commissions.
Okay.
On the UH1 though, on their Advantage Guard, you know, on the hospital indemnity, is that, I mean, that, what about the second year on that?
Second year on that, do you remember the percentage on that one?
It does go down, but it's not by much.
Yeah.
This extension.
Yeah, it's like year 4, I believe is when it dips off. But on our commission schedule that we can provide. And by the way, if you guys want the commission schedules, you can email contracts@agentboost.com. They will provide them for you. If you don't get them, email Heather or myself, and we're happy to provide those for you nonstop. Especially the ancillary products. There's so many different products on there, and all the percentages. I was asked out in the hallway, and I'm like, yeah, I can guess within 5%, but I'm not for sure. And there's usually 3 states on there that have their own commission grid on it as well. You guys can guess what states those are.
I can
It's the
tell
same
you
issues.
for Allstate, it's 18 to 20% on the short term of annual premium.
Question.
If we're, if we put on our ACA fund that has like one of those really high deductibles, then we layer in like some STM plans and other ancillary stuff, is there anything that we need to know or educate the consumer on with like how the billing is all gonna play out?
Well, your billing, so let's say that you have a 0 premium ACA plan, you're not gonna have to worry about it on that side. But let's say that you're gonna have a paid premium on it. Let's use Utah for example. Through Health Sherpa, and let's say then you're using a Select Health plan, it'll generate you to the next page where you will actually set up a ETF for your client or a credit card payment to pay that payment on it. When you're selling a Allstate or a UH1 product on it, and by the way, when you guys are selling ancillary products, do not use credit cards whatsoever. If you want to use it on the ACA premium, go for it. A lot of the bonuses, they will not pay out if you use a credit card. Only use bank draft with that, just to be very clear on that. I know people like credit card points, but the bonus money that comes out, they will not do it off of credit cards. And it makes sense though, because those companies are drafting hundreds of dollars of premium. They're paying a 3% transaction fee or 2%. They're trying to put money in the agent's pocket, so I get why they're asking for a bank draft. Also on top of that, it keeps the consumer on there. Out of our own internal call center, we don't allow us to write any credit card payments. It all has to be ETF on ancillary products. The reason for that is it drops off a month or two after. Bank drafts, they usually always stick. Plus credit cards expire, bank and routing numbers never do. So, so you just have to educate them on what the name of it is. And the reason we like UH1 and Allstate, those are names that people trust. There's some other competitors out there where they have life or something in it. So GTL, Guaranteed Trust Life on there. People see that on their bank statement, they're like, I have life insurance? No, you have a hospital indemnity plan. So you have to educate them on what's gonna come out on their draft, and you can pick the day of when it's gonna be drafted. That's a really good question.
I'll also throw it out there is just make sure that they understand these are two separate policies. It's not all in one. Accident policies and hospital indemnity policies are going to require a consumer to file a claim. So if you don't know how that works, please educate yourself. Both United Healthcare and Allstate have wonderful reps who we work with directly, who if you don't know how it works, give them a call.
And we have other ancillary products out there. The reason why we're highlighting these two companies out there is how big is United Healthcare? How big is Allstate? They're gonna be around in the industry. They pay high commissions. Your consumer knows it. There's a million ancillary products out there. If you guys want to talk about them, we're happy to. But we've decided as an organization that we want to put our agents in the best process, because the worst thing that can happen is you sell an ancillary plan and that dental claim doesn't get paid. Well, you just lost a Medicare client. You just lost an ACA client. There's a lot more money in there. We want to make sure that we're protecting our main product. So that's why we choose to work with those two companies. Any other questions? Yeah.
Question about income matching. So Heather stated not to use the question like, what do you think you can make? What's the appropriate way? And I've generally said, what is your income, what do you anticipate your income to be? So what's the proper way, or how
You're
should
probably okay to phrase it that way. What do you anticipate? I also will ask them, especially our self-employment people, what did it look like for you last year? Do you think it's gonna be about the same? A little less, a little more? Where do you think it needs to be? It's where you're getting those people who are below 100% of federal poverty level, where they're making really $7,000 or $8,000 a year, and they really shouldn't be on an ACA plan. That's when you get danger.
And she's a little bit more compliant than I am on asking. I'm always like, hey, let's estimate, let's put where it is. Call me mid-year if you're making more money, because obviously the goal is to make more money, and then we can adjust from there. Let's say that you're gonna be a couple $1,000s over. Let's talk earlier. Maybe we put that money into an IRA. Maybe we open a health savings account where we can defer some of that money to lower down our income at the end of the year. And I would educate your consumers, hire a CPA, don't do your own taxes. Bottom line, CPAs will be able to help you and keep that dollar amount low. So that's very important. We see people who try and file their own all the time. Go to H&R Block, it's like $80 or something to have them file your taxes. It's gonna save you thousands of dollars in the long run. Any other questions? Ask away. You guys are a very easy group.
You are.
Do we know, has anything changed on the triggers for income verification as far as, I think it's like been a 25% difference year over year that's triggered it. Is that changing the bill? Or is that
It's actually trusted, they call it trusted resources. So they look at what they filed with the IRS. If it's, considerably lower, what they.
I think it was 25% would trigger it automatically. Is it staying that, or is it going to be different? Are they tightening that further, or?
The way the Republicans have talked about it in the bills is they want to tighten stuff down more and more. But then you saw that lawsuit that just happened. My guess is you're going to see less and less triggers moving forward after that lawsuit.
Less triggers?
Yes.
Oh.
Because federal judges, that's kind of the new term on everything. They will put a stay in, and then it's going to eventually get up to the Supreme Court. And it doesn't matter if this is a health insurance product, whatever it is. there's going to be a lawsuit on almost everything, and it's going to be filed right outside of Washington, D.C., if that makes sense to everyone.
Can you talk a little bit more about these forms and Nico and all that stuff, like how that works to get it more efficient?
So they will be forms that will be fed right to your CRM. So consumer has a link. You can generate a campaign off of that or a workflow off of that will look at how your consumer fill it out. It's going to pop it into your CRM as an opportunity. So if it's somebody who maybe their income is considerably lower, maybe they say their income's changed, it's going to throw you in a priority box so that you know that, hey, this person, I'm going to need to take priority to update that information. Then it's also going to have different triggers, like if they schedule an appointment with you, different things like that.
Also, why is it so weird this year? What's going on? Like, who's doing this?
There's a lot of legislation changes.
Okay.
Change of administration.
Administration
You
changes.
can have all three houses controlled by one side of the government. There's not typical. Usually in a mid-year election, you kind of split. Right now, depending on what they decide to do, from what we're being told from all the government people, it could stay the same, or we could have a split government. No one really knows what's going on. There's such an indifference on the amount of people that are voting. You go back to COVID years, where everything was loaded. Well, it's all expired right now, and people are like, "Well, I don't want to spend any money." Then you throw in the Doge section of it. Hey, we're not going to spend any money into it. So there's just so much uncertainty. But kind of like what I alluded to this morning, you have 4 states that are going to decide what happens the next 2 years. Are we going to really fight over a couple $2 billion into a bill when they waste that on one bond that they set off? Yes, exactly.
Okay, you said a couple times that 2026 will allow every bronze plan to contribute to an HSA account. That every bronze plan is HSA eligible.
Yes.
Okay, so currently Select Health has a bronze copay plan.
Yes.
Which is excellent. It gives you first dollar contributions to copay. Like an MRI, it's like $140. Personally, you go to like telecom imaging versus $750 at the hospital. But normally you have a deductible that has to be $1,650 per person and $3,300 per family.
Yep.
So you can't have first dollar things. So those two things don't match in my head.
Yep.
I'm wondering how that works.
So they're calling 03B, the big beautiful bill that passed, codified it that all bronze plans, doesn't matter, will be HSA eligible, period.
Yeah. So you're going to see changes in plans.
That's actually very significant.
Yes. And actually, United Healthcare was the first one to announce that all bronze plans were going to go, and that was kind
Are
of
they
the.
getting rid of their copay plans?
No.
Okay.
Ed's here for that. They.
Select Health will talk this afternoon.
Well, I'm just.
You'll have so. No, it's really good questions that you're asking. But the big indication for me was, hey, one of the biggest companies in the world is announcing this. Everyone was following suit right after onto it. And it's going to be a great thing for consumers because it's going to lower that amount down because everyone's going to have increased premiums on it. Because when you, obviously when you put money into an HSA, you can lower down your tax liability. Any more questions? Yeah?
So I've seen some stuff about active enrollments.
Yep.
You're not actively re-enrolling them, you're not going to get paid commissions on that.
We don't know what's happening with commissions.
Okay, so what Jared just said, by the way, if you guys don't know Jared, he runs the Mesquite office, which allows all of you to do business in Nevada. We have to have a physical location in Nevada in order for you guys to do business. We're one of the only FMOs outside of the state that allows you to do business in Nevada. It's a very, very difficult state-based exchange. We are literally surrounded by some of the worst states in the country when it comes to state-based exchanges. So if you guys want to do business, I suggest on the West Coast, Utah, Arizona. That's my opinion, though. Onto it. But if you want to dive into those state bases and deal with it, then you do have an option in Nevada. What his question was, active enrollments. And I think what he's kind of alluding to is that $5 rule that you guys talked about. Well, that's going back to that court stay. They filed it at the very last minute. They had that planned for 6 months probably in advance. But that's going away. So essentially what that was, if your client was auto-enrolled last January, you were either going to have to touch them from September 1st through the end of the year. And if they were auto-enrolled, they would have to make a $5 premium payment. Well, when we were back in Washington, D.C., they were like, they made this big announcement, but they're going to get that $5 back on their taxes. You know, like that's going to make such a big deal. So that was one of the things we really loved about that court stay that happened. And I'm someone who doesn't like court stays, but a lot of the stuff in that court stay were really, really good for the consumers during that. So the active enrollment right now is not applicable because of that lawsuit. Any more questions? Yeah,
Is
Jeff.
the consent form the same old one we were using
There's-
3 years ago?
Health Sherpa has a new intake and consent form, so I would encourage you to leverage the Health Sherpa consent form. They have an intake and consent form. It's great because it's then stored within your system, and you don't have to have somewhere else because you have to store them for 10 years.
Or if you use our CRM system, you
Yeah,
get
that too.
consent on the recorded call because we already store it for Medicare, then you don't have to deal with it. That's what I suggest everyone does. Because you're already doing it on Medicare, it makes it a lot easier. More questions? Anyone? Nothing? Wow, you guys are a really easy group. Okay, so quick suggestion, which I didn't talk about earlier because we have a couple extra minutes. Those of you right now who need an FFM certification, we are suggesting that you get a Georgia license and sell in Georgia. All the carriers are in Georgia right now. I'm talking national ones, obviously we're not talking about Select Health or University of Utah because they're just here. But if you file in Georgia, you have United Healthcare, you have Ambetter, you have all the big national carriers, you have Oscar, you have them all there, you have Cigna. We can get you appointed. As soon as FFM comes out, we can turn on all your other states and we don't have to wait those couple of weeks. With the FFM coming out in a couple of weeks, we want to get that ball rolling because all these carriers are going to be flooded with hundreds of thousands of contracts. So if you have any agents or you're looking to hire people, do that. Because they're in Utah, you have to do an affidavit and have it notarized. You can come into Agent Boost and we will notarize any of those documents to help get that done. Our contracting team is really good at it for you.
Georgia is the only state-based exchange that operates on Health Sherpa. That's why we say Georgia. So you could still use Health Sherpa, still use the same system. You'll notice the application's a tiny bit different, but you can use Health Sherpa.
And if you're looking to make a lot of money, I would sell in Georgia this year. There's some carriers that are rolling stuff back. There's some carriers that are expanding in there. There's some really good opportunities if you wanted to build a book of business in Georgia. And I will say because they changed some of their methods because they got kind of hammered last open enrollment with fraud, all those fraudsters are completely staying away from Georgia. So we're very, very excited about Georgia this coming year. I bet you it moves into one of our top 5 states that we enroll people with. Any other questions from anyone before we wrap up? All right, Heather, are you going to go through the last 2 carriers? So Heather's actually going to present on 2 carriers really quick that weren't able to make it. And one of them kind of has some significant changes, but the other carriers kind of offset it onto it, so we're excited about that. So I'm going to pass over to her, and then we're going to have Natalie from Cigna come up, and we'll eat lunch a little bit early and stay ahead of time. Also, at the end of the day, we have a special guest from the investigation unit of Select Health. He is going to come in and talk about fraud and how they catch fraudsters. I've seen him speak before. I specifically asked for him to come here. He gives awesome presentations, so we have something really good at the end for you guys.
I'm going to quickly fly through Anthem. So Anthem is also WellPoint. So they have jump real quick. So they've got Anthem, Blue Cross Blue Shield in 14 states. They also go by the name of WellPoint. WellPoint is where they go in where they can't file as a Blue, but they have a similar Blue Cross network because they have the Medicaid contracts in those states. This is their footprint for Anthem. He couldn't give me the WellPoint because they can't intermingle, but I will just throw it out there. Texas, Florida, Maryland, they are entering Washington. It's not going to be real significant, but they are expanding in Texas. About 1 in 3 Americans are on a Blue Cross Blue Shield plan. Of those 100 million members, 46 million of them belong to Anthem. They're huge. A couple things on their member tools. So they do have the opportunity to create a member portal, access their ID cards. They can access their billing and claims. They can see their prescriptions, all of that in their system. They also have the Sydney Health mobile app. This Sydney Health mobile app is the same app that even people who have group Anthem plans, it's It's the same app, so they have that ability. They can access their card, they can connect with customer service 24/7. They also can look at their claims and see their plan usage and fill prescriptions. Jump here. So we talked a little bit about this. I'm going to just jump to the slide where he talks about one of the things that they do have this year. They have partnered with this company called Patient. It gives your members with Anthem access to a $1,000 line of credit, no credit checks. They can access this to help pay for their care. No cost to them, no interest.
Can you go back to what you just said about
Sorry.
$1,000 line of credit to pay their previous?
This right here, so it's this patient healthcare spending. So they have access to a $1,000 line of credit, no questions asked, no qualifications required. It's a partnership with Anthem. It's a Visa card that they can use so that they can continue to access care even if they don't have the funds available to do it. $1,000 per individual, $2,000 per family.
But they're gonna have to pay it back. It's gonna be a
Yes.
flexible payment plan, so it's
Yes.
different from an HSA. HSA, you are putting money in there.
This is not, it's not an HSA. This is a line of credit for them.
It's just a line of credit.
Yep.
It's just a line of credit.
Yep. Just makes it so they can continue to access care.
Okay.
No, it's not an FSA.
How you fund it, you get access to the funds at the beginning of the year, but you pay that towards that.
It's not an FSA.
No, I know it's not. Just saying.
So. Yep. Okay. As an agent, you also have access to their. Oops, I think I went backwards. Sorry, guys. Okay. As an agent, you have access to the broker tools. So you've got the producer toolbox. You can access their cards at any time. You can also access your book of business. All of your information is in there. Please leverage the renewal reports. So if you are selling outside of Utah, please use their renewal reports. This is the broker hub. They also have an app which exactly mirrors the producer toolbox. This is what I was talking about earlier about actuarial values. So in 2026, there were some things in the program integrity rule that allowed carriers to have an actuarial value lower than what it could have been before. So you saw in 2025, a silver plan had to be 70 to 72% actuarial value. That was broadened to 66 to 72%, so it's considerably larger. If there is nothing that happens with the court stay, they will be required to refile their plans because they will have to go back to the skinny actuarial value on the plans. So stay tuned. The new hardship exemptions for catastrophic plans. So in the Anthem states, they have filed for catastrophic plans. Anybody who makes less than 100% of federal poverty level or more than 400% of federal poverty level, this actually just came out last week, will be eligible for a hardship. And they are working on getting everything set up so that when you quote them in the marketplace and they're less than 100% of federal poverty or over 400%, which means they're not eligible for those advanced premium tax credits, they are eligible for a catastrophic plan. These plans are gonna have like a $10,000 plus deductible, and then they are covered. There was also the Federal No Surprises Act. So the Federal No Surprises Act goes into effect January 1st of 2026. This means that for non-emergencies for the ambulance, it excludes air ambulances, but they cannot, what do they call it? They can't bill them over the allowed amount, what the carrier says. They have to say if they're out of network and let them know what the cost is. There's also information information about autism. It moved from a medical benefit rather than a mental health. It's now defined as a mental health, and age limits on autism services are removed from the plan. So it used to be it was 18 or lower that it was considered a medical benefit. Over it was a mental health benefit. That's changing. It's actually good.
Is that gonna be true for the short-term rentals? Because short-term rental doesn't include mental health. So will autism be covered under short-term rental or not?
No.
I noticed that with I noticed sort of for ACA. I'm just saying if it's making
Short-term plans, I want to just clarify real quick. Short-term plans are not ACA compliant, meaning they have the limits. But I don't think, because they don't cover mental health.
Correct.
Okay, and they are expanding what they're covering underneath the breast cancer and cervical cancer screenings. I'm going to jump fast through ICRA. They do have some ICRA specific plans, so take a look at those states. If you write in those states, they are going to have ICRA states. I think the rest of it is on ICRA. Do you want me to just...
No, skip through ICRA.
Here's their broker support number. We do have a rep specifically with Anthem, so if you do write in Anthem states, please let me know and I can get you in touch with our broker rep if you need help with anything on Anthem. And that's all I got.
Perfect. Want to introduce Natalie?
Yeah. So next up is our Cigna rep. We're going to find her. Her name's Natalie Milas. She just recently got married, I'll just say that. She's a great young gal. Anxious to get Cigna going. I know here in Utah, Cigna has had a bad name. Across the nation, they are expanding, not contracting. They're one of the few carriers who are expanding. I'm not going to steal her thunder, but I'm going to let her tell you where she's expanding. They have kept great commissions rates as well. They have both the ACA market and dental and vision. We don't necessarily target their dental and vision, but she might talk about it. So
Talk about Sheila Pryor now being on group with Cigna.
yes,
Yeah.
our former Cigna rep Sheila Pryor is now on the group side. So if you're writing group, let us know. We can connect you with Sheila Pryor. She can help you with your group coverage. So without further ado, I'm going to introduce Natalie. Anna. Give her a big round of applause. So it's
All right, so I'll answer a couple more questions for you guys. Heather, if you want to jump back up on stage, we're trying to get her presentation downloaded. It's got too many size or whatever on it. Any questions from anyone here? Nothing? Yes.
Will you repeat again all the things that you said they're going to start regulating in regards to ACA? Income is one of them, loss of Medicaid.
Loss of health coverage right now you have to show proof on. The reason for that is, what did Oz say in DC? Was it 80% of applications? Ed, you were there. Was it 80%? 80% of applications that were fraudulent came through the election code loss of health coverage. That's why they shut that down so quickly on it. And that's kind of, brought back a lot of the fraud from going out of the business.
So how do they show that?
What?
loss of Medicaid.
Yeah, loss of employer group coverage. How do they?
Oh,
Have to have a
you,
letter.
you just show the letter. or you can grab one from your employer. You upload that letter through Health Sherpa's link. They're pretty easy on it. They're not sticklers. But I would say if you can use one of those other SEP election codes, it goes through right away right now. There's no looking at it. Let's say that you use moved as an SCP. You put a different zip code. They are not asking for any proof. It's going right through the system right now. So if one of those other SCPs do work for you, use it. But I'm telling you, there's only a couple of them that they're really checking on right now. Yeah?
Also, like with loss of coverage, I think it's important to note that you're like in a quote-unquote grace period until it gets approved. So
Yeah.
get that letter as soon as possible.
Yes, absolutely, because that expires and then they'll say, hey, that SCP doesn't work anymore. So that's a really good point. Thank you, Tyler. Yeah.
What's the easiest way to set up an HSA?
Easiest way to set up an HSA account. So we do not have, we're not licensed financial advisors onto it, but I can tell you, you can call Fidelity, you can call Principal, you can call any of these carriers.
Health
and
equity is really good for everybody.
Health Equity, you can call any of them. Where you have your investment accounts, you can. And then I can't speak to this, but I'm going to let Ed answer this one because he's got a really good answer.
So if you enroll a customer in a United Healthcare, we actually have HSA through Optum. So you would let them know, hey, you now are HSA eligible. Be on the lookout for an email or communications outreach from Optum. Okay.
And those of you who don't know, Optum and UHC are combined. I'm really glad he's in the room because that's the one product I can't legally talk about up on stage. But if you do log into those, I will tell you this. We just switched our employer coverage here at Agent Boost. And I had HSA. I called where I had my money invested at Fidelity and was easily able to just move it over, and you can open that account. It takes like 30 seconds. And if you don't have one, you just have to sign up and you can have that account made really quick. Yeah.
So is that only for broadband or UHC?
On the IFP side, yes. Right. So you can't have HSA plans anymore.
Okay.
It's only bronze.
Technical difficulties are over. If you have more HSA questions, find Ed or one of us a little bit later. But we're going to pass it over to Natalie now.
All right. We're back, and this time here to stay. So good morning, everyone. Happy to be here. I'm going to kick us off, and we'll run through these slides. And if you have any questions, wait till the end or find me later. So starting with this, I really want to emphasize the as of 9/9. I think this ties in perfectly to what Heather just talked about, right? The AV values are changing. I think I was boasting yesterday to some of you that we were one of the carriers that didn't have to refile in the last couple months, but now with this new announcement, we do have to. So calling out, I spent some time this morning editing my deck so that most of the things in here are still true and accurate, but there still could be some changes now, and I wasn't able to show everything because we now have to refile and don't really have a choice. All right, so here's what we're gonna run through. The best sections here that I'll really want us to spend some time on is market insights and product highlights. With the product highlights, again, that is what we can talk about today. And then just quickly to introduce myself, so I think it's kind of great that Heather called out Sheila Pryor as your group contact. So if you were here last year, you remember Sheila was the one up here leading the charge, so obviously things have changed. And so I'm Natalie Milas, your new broker manager for Cigna under 65, ACA, and then that also applies to our standalone dental products that I will be talking about a little bit in this deck. Just a couple fun facts about me. So I'm from Pittsburgh, diehard Penn Stater, just moved to Charlotte and spent my 20s in Chicago. So if any of that interests you, feel free to talk to me later. All right, so diving in to Cigna Healthcare. So I made a joke recently, I don't know if it was to Heather, that my goal this fall is to make us relevant again. I know the last couple years, we've had some big price increases, book sizes has come down, and I just want to make sure we're not forgotten and still remain a carrier of choice, right? And so with that, just looking at where Cigna's at, we have undergone some changes. So I love this slide to call out our government business and how that has changed. So currently present day, our Cigna Healthcare under 65 individual and family plans is now the only business making up Cigna's government, right? Our Medicare Advantage, MedSup, has all moved over to Blue Cross Blue Shield, also known as HCSC, and they are going back to that HealthSpring name that they had several years ago. So when you think Cigna, besides obviously our group plans, our under 65 ACA is really the only Cigna that should now come to mind as you head into this open enrollment with all the changes that our company has gone through. All right. So diving into some value here, I mean, this is just reminding you of some things we have. Obviously, I am here, meeting all of you for the first time. I also have a dedicated account manager, Maria, who helps me support my agencies on a daily basis and has done a great job so far with Agent Boost. We have a broker support team. I will flash that number and contact info up at the end. Also want to call out some resources we have. I will show a few of those at the end. Quote and enroll tools, co-branded marketing, our amazing broker resource center that should be available any week now. And then Cigna for brokers, right? And calling out the broker payment feature we introduced last year. We'll review that again at the end. And then also calling out Dental Pro, which is going live October 1st, which will be our new and improved dental quote and enroll platform. So just some things what makes us different. Customer first, right? We've always prided ourselves on our customer service. I'd like to think we don't have as many customer issues that make its way to the broker manager team as other carriers. Financial stability. I want to zone in on this one because I did call out that, we've had some bad years, right? We boomed in Georgia and Texas now 3 years ago, and we had to shed a lot of that bad membership and get back on track to being financially stable, right? And so you'll see this year, I think, finally us doing some positive moves that clearly showcase, we're back on track. We're not gonna grow at the pace we did a couple of years ago, but we're doing things right. We're doing it smart, and we're really here to stay and navigate this wild ACA world we're living in and, the upcoming and pending changes. So diving into member value. I kind of go quick through this section because you guys, I think, know a lot of this stuff. And if you don't, feel free to pull me after and we can dive a lot deeper. MyCigna.com, the app that is not changing. When you enroll a new Cigna customer, once they make their binder payment, they have to wait 7 to 10 days, and then they can sign up within MyCigna in the app. They can register with their social security number, and then within MyCigna is everything they need, right? Provider search tools, paying their bill, viewing claims, the list goes on. I also want to call out virtual care. We'll hit on that in a couple slides. There are some fun changes there. Pharmacy resources. And then one thing that's not up here is our rewards program. So while we have a lot of things pending right now, the rewards program is actually one of them on our side. We're making some changes to that, and so when we finally have that finalized, we will be announcing what we're doing in terms of our rewards program for next year. We will still be having customer incentives, it's just gonna look a bit different than in past years. So calling out another change for 2026, we are going digital with our ID cards. So we will no longer be mailing physical cards. I'm gonna be honest, I wasn't thrilled about this. I know some of you probably aren't either. But this one is just out of my control, and they're trying to showcase the ways that this is a right move, right? With smartphones everywhere, ID cards easily on your phone within the app. And so this is kind of the future for us. Now with that said, some positives of this. So if a customer still wants a physical ID card and they come to you, right now you can direct them, give them the customer service number, and they can still request a physical card be mailed to them. I want to push that for any customer that really needs that physical card. Now for you as agents, you are going to see for this open enrollment the member ID number within the book of business. That's coming, so you could at least provide them that ID number as like a band-aid until they either get a physical card or figure out how to access it online. And then on top of that, and this will be probably just knowing how we operate, like a Q2 move, will finally be that feature in the broker portal for you to be able to send them their ID cards yourself, right? So that is finally coming. I'm really excited about it, but I'm not gonna say it's Q1 when I know in my heart it will probably be Q2. All right, so virtual care, just calling out some changes here. And I love to think we've been able to enhance our virtual care every year because Cigna does own MD Live. So by having MD Live as a Cigna company, I just feel like each year our virtual care gets more and more comprehensive. So you can see urgent care, routine visits, primary visits. I love that e-form that we introduced last year. So that's where a customer doesn't have to call. They can fill out a form with what's wrong with them. A doctor gets back to them on their own time, and if they need a prescription, they send it into the pharmacy. So that kind of removes having to go consult a doctor at all and just do it on your own time. Some new features this year, Visana Health, virtual gynecology clinic, that's pretty cool. 9 a.m. health to help with diabetes management, and then Heartbeat Health to help as like a cardiology program that's online. So just lots and lots of things you can do now with our virtual care. Bumping to pharmacy support. So you all know Express Scripts, that's another Cigna company. They're our go-to home delivery. We have a Credo specialty pharmacy, basically helping patients with complex medical conditions manage those medications. We have the Walgreens Advantage Network. This applies to 9 of our 11 states. And then in Texas and Virginia, it is still the CVS 90 now. So think for all our other 9 states, we will flash those up in a couple slides. We have Walgreens Advantage, and then in Virginia and Texas, we have the CVS 90 now. Caveat with those networks, can really go wherever you want, but within the Walgreens Advantage network, you cannot go to CVS for a 90-day supply, and then within the CVS 90 now network, you cannot go to Walgreens for a 90-day supply. Patient assurance program, just discounts on insulins, and then always love to call out utilizing our formulary. And then this is just a reminder that we have healthy reward discounts. We're not gonna get into these, but you know, sometimes I'm asked about this, so I always find this slide helpful to throw out. All right, so getting more to the fun part of the presentation, our 2026 IFP footprint. So let's just pull the room. How many of you thought we were probably gonna exit another state in 2026? You can be honest, I heard the rumors. So we're not. We're gonna make that very clear. And so you can see our medical footprint up here. And fun fact, if you didn't already know, we are actually expanding within 6 of our 11 states. So I'm trying to drive this home because, you know, I know we exited some states last year. Utah was one of them. You know, I'm sorry to those of you in the group that heavily affected, but we are good at making the right calls. You know, I called out getting financially on track, right? You know, slow, steady growth. We're not gonna do anything crazy. And our state exits were smart and tactful, and I think contributed to us being in a more stable spot. So while we're not adding any new states for 27, I think 20 counties is something. And depending on the state, that expansion is kind of noteworthy. So we'll get into that more in a few slides. And if you come by my table, I have our map with all the counties we're in as well as the new ones. So that might be just a nice paper for you to take home with you. But really excited about this, especially in a world where, you know, a lot of the other carriers aren't really expanding at all. I think, you know, at least we're doing something and trying to become relevant again. So calling out our dental plans. I also have brochures at my table to talk about these. And you know, I really want to drive our dental home because we are running a bonus right now for our dental plans. So first showing off the footprint. If it's green, all 7 of our dental plans are offered there. And then from there, I mean, you can read the slide. This map is also featured in our brochure. And then to call out our plans and some other things. So if you're appointed with Cigna under 65 and ACA, you can sell these dental plans, and they're guaranteed issue all ages. So you can sell them to those over 65 customers as well. In fact, 30% of our dental customers are actually over 65. And you can see why it's appealing, because I like to call out that our dental suite really has something for everyone. You look at that 1,500 up there, it covers orthodontia. We have the dental vision hearing plans. This DVH 3500 does cover the class 5 implants. You don't always see that. Now with the implants and orthodontia, no way around it. You do have to wait the 12-month waiting period, but at least you're getting that coverage. I also want to call out just in general, we do waive waiting periods with proof of prior coverage. You know the drill, at least 12 months, no more than 63 days in between those policies. But that prior coverage could really be anything, as long as it mirrors, you know, the plan that they're going on. You can't be on a preventative and go to the Cigna Dental 1500 and expect your class 2 and 3 are going to be waived, right? You're still going to have to wait that out. Then finally calling out the high annual maximum plan, only up to class 3 coverage, but the benefits on this are pretty great. You know, you see that nice high annual maximum, yes?
Previous coverage, waiving the
Yes.
waiting period. Does Medicare Advantage in dental count as?
Yes.
Okay.
Yes.
So if they've got a Medicare Advantage plan that's losing their dental.
That would
for
completely
next-
count.
That
Yes.
completely works?
Yes.
No wait.
And within the application, you just kind of put in the plan that they were on and the dental coverage they had, and we verify that on our side.
Okay.
So with the high annual maximum, talked about the 3,000. Really nice average premium, and I would say in general, the pricing of our plans is pretty competitive and fair across the country. Now with the high annual maximum, you notice it has a different network than the other 2 plans. So that total Cigna network is the 2nd largest dental network in the country. It's almost 150,000 dentists nationwide. So it's a really nice plan if they only need up to class 3 coverage and are looking for access to a wider network. Our other network, the Advantage, that applies to the other 6 plans, it's fine, it does the job. Sometimes it has your dentist, sometimes it doesn't. So I just love to call out the differences and how you can see the tagline, there's a plan for everyone, really hits with the 7 plans that we have. Now hinting at our dental bonus, and I will show a slide for this. Right now, if you sell 10 plans, on the 11th plan, it will be $25 per policy, and that goes from now until the end of the year. Now I would say, you know, as a part of Agent Boost, you guys really crank up the dental production, especially as we get into AEP, OEP. You know, there's an option to try to extend this dental bonus, but it's only if we see it being successful. So just, you know, take that as you will, but if we extend it, that's ultimately just more money you could earn because it's cumulative once you get to that 11th member. All right, so diving into product highlights. Now this was the section I was editing this morning. So what we have should remain, but there'll probably be more added to this section as we know what changes we have to make on our plans as we refile with these new AV requirements. So important to note, with Cigna and the 11 states we have, we're in 4 state-based exchanges. We'll dive into that a little bit more later. We've been boasting very copay forward plan design. So what that means, right, is just seeing more copays on select benefits. I love to call out lab copays, ER per visit copays, inpatient copay per days, and just kind of pivoting more to that model in a lot of our states. We'll talk about this more in a little bit. We're introducing an HMO in Florida. Very excited about this. Kind of taking a page from Blue Cross's bookshelf down there. We have the My Heart plans we'll talk about in a second, and then the diabetes care plans that we've had for years now and tend to sell really well for us. Looking at pharmacy takeaways, we talked about some of this. In Arizona and Mississippi, we're going to have auto refills for home delivery. Really excited about that. We have drug copays at $0 to $3 on tier 1, pretty standard. And then on a lot of our plans now, drug copays up to tier 3. I do want to call out on Cigna, we do have a 5-tier benefit design, which is a little less traditional than what you see out there. It allows us to just kind of split up tier 1 into 2 tiers, offering more competitive prices, let's say for tier 1, and just separating, you know, the preferred drugs we want you to use versus the non, if that makes sense. Now on the CMS standard plans that we still have, those are still this classic 4 tiers and the same formulary that you're used to seeing. And this just all kind of leads to my preach of utilizing our formulary to track drugs and see what tier they're covered on. Our formulary should be your source of truth over checking in Health Sherpa. Now talking about that diabetes care plan. So you can see where we offer this and in what metals. I love this plan. It's been one of my favorite talking points for years. So $0 on those preferred insulins and non-insulins. I have the list for you if you'd like to see it. You can also search that in the formulary. $0 as well on diabetes supplies, equipment, certain services, nutritional counseling, podiatrist visits. And I love to call it the equipment because if you're familiar at all, you know that some of that diabetic equipment can get to be very expensive, right? So think about that Dexcom sensor, Freestyle Libre. With this plan, they can get that equipment for $0. Also want to call out the patient assurance program. So if you're not on a diabetes care plan, you can still get that preferred insulin for $25 for a 30-day supply and $75 for a 90-day.
Under metal offerings in Indiana, bronze and silver off only. Does that mean off exchange?
No. The silver is off only.
Gotcha.
All right, with my heart plan. So this is new. I'm really excited about this one. So kind of think about our diabetes plan and let's apply it to those patients or customers that are dealing with cardiovascular issues, right? So with the My Heart Care plan, heart health benefits at $0. So this applies to their select cardiac drugs. You can see some examples up there. Their ECGs, their panels, cardiac rehabilitation. And this is new. You know, I don't think I've seen anything like this get out there in the market. So excited to see how it does. Now, obviously, this is a pilot, right? So it's not available in as many states as our diabetes care plan, but who knows if it does well. I wouldn't be surprised if next year this is offered in more states. But you can see Illinois Gold, Mississippi, Tennessee Silver and off exchange only, and then Gold in Virginia. So plan highlights across markets. This is a nice table that I think will get more robust once again as we know how our plans shape out with the refiling. But I do still find this one helpful. You know, you're an agent selling in multiple states. This is a nice slide to take a screenshot of, have a pic maybe on the side of your desk, because it tells you where we have unique offerings and in what states. So that $0 med and RX deductible, only off exchange in Tennessee and Texas. The split deductible with the $0 med, set drug deductible. You can see the 4 states that's in, where we have an HSA, and if that HSA is off exchange only, where we have our off exchange only plans. And yes, does that kind of hint at our ICHRA strategy? Of course, right? The states where we're having more strategic off exchange plan designs is where we are hoping to grow our ICHRA business. HMO, EPO, want to just call out the difference here. So if it's an EPO, biggest thing is referrals are not required and PCP selection, auto sign, not required, right? The HMOs, honestly, kind of the same, but you just don't drive the point home as much. And again, on the next slide, we'll talk a bit more about the Florida HMO we're introducing. And then you can see the other states where we have the inpatient copay, ER per occurrence copays, and then we already talked about the diabetes care and the heart care. All right, so some key market insights. So on this slide, I just love to quickly hint on pricing, right? So I mentioned, you know, up until the AV requirement changes, we weren't looking to refile. We were kind of hopeful, as everyone else was, that this would really work out nicely for us. But alas, you know, we're just gonna have to wait and see. We did take some big increases in certain states the last couple of years. And I'm hopeful that in most of our states, probably besides Texas and Georgia, if I'm being honest, you will see some very fair and honestly competitive pricing that I'm excited about, right? So talking networks, I love to just call out at a high level the states where we have really strong networks, right? You know, you probably don't know niche all the systems and all these states, but you can tell based on the state, like, wow, they really have a lot of hospitals there. That it's a nice, strong selling point for us that I want you to take home. So Arizona, and now I will tease, you can see it up there, we are expanding into Tucson. So we'll be in Maricopa and then Yavapai and then the Tucson area. We'll have the Tucson Medical Center as the main anchor partner there. Love to call out the Ever North Care Group because that is a part of Cigna, right? It's our own care group in the Phoenix area. Colorado, nothing new, but consistently strong network. Florida, again, we have the HMO we'll talk about. And then in Illinois, really want to zone in on Illinois. I used to manage the state. We had a terrible network in Illinois 2 years ago. It was just awful, it was embarrassing. And within 2 years' time, we have added 3 major hospital systems, making our network in Illinois one of the most competitive. So we've added Rush, Silver Cross, and then this is very new, Endeavor, which any of you selling in the Chicagoland area, you'll know that's North Shore, and it's a huge deal that we were able to add them for 2026. All right, looking at some other states, Indiana. We got a big network add for this year, okay? We were able to add IU, so having IU in community really makes us stronger in that market. Mississippi, a lot going on there. We were finally able to add Merit Health in Biloxi, so we now have every system in South Mississippi. That is huge. We were able to add Baptist up in the South Haven, northwestern part of the state. And then upon our expansion into Jackson, Mississippi for 2026, we have St. Dominic's. Looking at North Carolina and Virginia, nothing new, just strong networks to call out. And then Tennessee, always one of our best and most consistent states. We have that statewide network solution and access to several systems, as you can see up there. And then just another reminder, pre-sale, post-sale, please use our directories and our formularies when checking stuff with us. You know, I've been doing this now for over 5 years, and every time a network issue comes up on HealthSharp, I'm like, well, did you check it in our directory first? So please just do that. I promise our websites are your source of truth, and if you have any issues, that is really where to go and verify what's accurate. So some market takeaways, and I promise we're almost done, but these are my favorite slides, so you know, take them as you will. So Arizona, we talked about the Tucson expansion. We called out the system we have there. The auto refill is another exciting thing. I want to just call out like commissions, not revealing anything at all today, but I think depending on the market, you'll see some changes, and some of those will be positive. So just kind of teasing that, and you know, hopeful that that helps us with our new sales. Looking at Colorado, again, stable, just a really great state. We had 2 really strong years in Colorado back to back, and we're hoping that'll kind of continue into 2026. Looking at Florida, I said I'm going to talk about the HMO. So we're still going to have the EPO, but with the HMO, you know, this really is designed to provide that value-based care a bit better and actually assign PCPs to customers that choose to go on this HMO plan. And part of this strategy, and why I mentioned the Florida Blues earlier, is that by having an HMO and EPO product, it's going to pave the way for us to get even more competitive in Florida and have better pricing, having an HMO and an EPO. So it's a really great thing that we're doing this, and I'm excited to see where this takes Florida beyond 2026. Also want to just call out, we had a killer year in Treasure Coast for 2025. It was one of our best markets. Hoping to see that remain strong, and looking to also get some business hopefully in Palm Beach and Collier County. Illinois, expanding into Lake County. That's a really nice one to add. We talked about a lot of the network expansion already, the My Heart plan. I do want to call out one other thing about Illinois, and this is important, so it needs to get out there. In Cook County, which I know I used to live in Cook County, it's the big one there, we are going off exchange only. So that is, you know, a big and necessary move to help us in Illinois more long term, but I want to call that out, and then just emphasizing that in the surrounding counties, those customers can still go to any of the hospital systems we have within Cook County. It's just Cook County residents can only enroll with us off exchange only, okay? One of the last slides here on this stuff. So Indiana, Evansville expansion we talked about. IU's huge for us. Mississippi, the Jackson expansion is really big. You know, the Mississippi agents I used to manage have been asking for that for years. The network changes in Mississippi are also really positive. North Carolina, we're adding Gaston County right outside of Charlotte. It's a big county, you know, it's not nothing in terms of expansion. And it's the 4th year we've slowly added counties in North Carolina. And it's actually the state with the largest Cigna footprint that we have. We're in about 85% of that state. So that's something we're pretty proud of. And then Virginia, we're adding more counties in the Richmond area. So you can see those names up there. Richmond has always done fairly well for us, and we're hoping in 2026 that that will be a really strong area with this expansion. And lastly, just some broker tools and resource reminders. Lovely broker portal. You click quote and enroll for medical, takes you to Health Sherpa. Dental right now takes you to Express app, but as I called out, October 1st, we are switching our dental platform to Dental Pro. So really excited about that and think it will be a better experience selling our dental plans. With those dental plans, you can only sell them on the broker portal. Okay, they're not on Health Sherpa, they're not on healthcare.gov. If what you heard today about our dental plans interested you, you gotta make sure you're logging into your Cigna for Brokers agent portal and clicking quote and enroll for dental. All right, couple other things. So I mentioned that we're adding some more fields in the book of business. We'll also have the customer name, case ID, and the writing agent NPN. Other things to call out, talked about Dental Pro, talked about Health Sherpa. Here are the 4 state-based exchanges that we're in. And you know, Heather called this out, Georgia, you can still do on Health Sherpa. Important to note there. Illinois is a new one for 2026, so if you sell in Illinois, make sure you're on top of that. And then the Resource Center coming soon. As soon as we have this out, we'll make sure it's blasted out to you guys, but it's just like a nice ungated website that you can just open up and have access to a lot of the things that you need to sell Cigna without having to log into the broker portal and do the multi-factor authentication. And then just some billing and enrollment reminders. Everyone knows the similar deadlines. You know, every year we always extend that December 31st one. You know, everyone does, so I'm sure that'll be the case again this year, but you never know. And then just enrollment dates, you guys know the drill. And then just some call outs for payment. So we did add broker portal payment last year. So you enroll a customer, maybe they don't want to pay their binder then and there. You can now go do it for them with their payment information within your broker portal. You can pay their binder payments, have access to a pending enrollment report, and then you can also make their monthly payments, you know, 1 month at a time, right? You cannot currently set up for auto pay within the broker portal. They have to do that on their own or at time of enrollment with you. I'm hoping that's something that changes in 2026, but I don't want to get my hopes up. And then the credit card can be used one time for binder payment, but not for ongoing. And then just flashing that dental bonus one more time, and we will be done. So it's already started. It's going right now. You know, if you guys have more dental questions, come talk to me. Please grab a brochure. You know, Agent Boost has this flyer. I'll make sure they send it out again. Just the one caveat, they need to stay on the books for 90 days to be bonus eligible. Okay, that's pretty standard with any bonus that you see. But you know, selling 10 dental plans now until December 1st, hopefully that's possible. And again, if we see the numbers tick up for you guys, I'm hoping really to push and extend that, but we need to see production to be able to do that. And then I'll just flash our contact info. You know, I called out Sheila was up here last year. You know, I've taken over. I've been managing our national partners for the last few months, and it's been really exciting. We do have a new and refreshed team, so we've had a lot of people we've brought on in the past few months. So it's important to start to advertise who's around. And if you sell in a specific state and you want that specific state's contact info for that broker manager, this might be a helpful slide for you. And then we also have dental broker managers as well. And then just the broker portal, broker support, and all the quick links you need. You know, we'll make sure you guys have these if you need them. And then that's it. So thank you guys.
Thank you, Natalie.
breaking news that kind of threw everyone off here for a minute. We're going to give everyone 30 seconds to make your way into the room.
Do you want me to share the 30 seconds?
And we have some industry breaking news that Heather is going to announce as well, which is probably more exciting than anything. And I don't know why we couldn't get a straightforward answer yesterday about this.
I know.
And I literally pressed him on it and said, now you're going to promise me this is done by October 1st. And he was like, hey, no promises. So, Heather, you announce that, and then I'll introduce Nicole.
So the FFM is going to launch on the 19th or 20th of this month. I told you it was very soon. There you go, very soon.
Well, there we go. Okay, so you guys might wonder, why is Ambetter our platinum sponsor here in Utah? Something for you guys to think about. Why would Ambetter be doing a big investment in the state of Utah? Can't talk more about it, but you guys are all very smart agents. So I'm very excited to introduce Nicole Smith. She's located out of Las Vegas, Nevada. People have tried to take her from our account many times, and I throw a fit. She's one of my absolute favorite in the industry. We're very lucky to have her. So anytime you guys need anything, you can reach out to her, especially if you want to sell in Nevada. She used to be a broker, so she knows exactly how to work the market, anything that you guys need, and obviously she represents us nationally in all states. So I'm going to pass it over to Nicole. No pressure.
Thank you. Oh my gosh. Tell me more. How's everybody feeling after lunch? Good? Food coma set in yet? Stay with me, okay? I know. I get the food comas myself. So yeah, this is going to be a really general overview because, as you know, we still have information filtering in for plan year 26. Rates aren't even finalized yet in markets. CMS, week to week, we're getting different information. So this is going to be a general overview about Ambetter Health, how you can utilize your tools, and then at the end, I'm going to announce 2 virtual trainings that will launch online for you guys, where we can really drill down on some of the 2026 stuff. Okay. All right, so a little bit about who we are. Just so you know who you're partnering with, okay, when you work with us, we are the #1 marketplace carrier in the United States. About 1 in 7 ACA shoppers do choose an Ambetter Health plan, and currently we are right at 6 million members, so we're 5.99 million members across the US. You can see on that map, everything you see in pink is our footprint currently. I always tell everybody, just ignore California and New York, and I'll explain why. We do have Ambetter branded products there, but they don't participate in what we call reciprocity, and I'm going to touch on that in a little bit. But you just kind of have to act like California and New York don't exist. And then, I'm sorry? Okay, good.
Exactly.
Good, you're with me. Okay, and we've been around since 2013, so since the plans have been launched in the marketplace, we've been there. And you guys are probably going to see .centene, like in emails that you receive from us. We love to confuse the heck out of people. So Centene is our parent company, and they do own Ambetter Health, which is all ACA, and they also own WellCare, which is your Medicare partner. Okay, so not to be confused, Centene's the parent company, and Centene ranks number 22 on the Fortune 500 list with more than 30 years of experience. And I share this with you just because you know that you can feel secure in running your business with us, because we've been around a long time and we do know what we're doing. Okay, so here's the footprint again, and with this I want to talk a little bit about reciprocity, but first, the most recent market changes that we experienced were last year. Iowa launched, so if you're looking to expand into that market, you want to add that state. It came on board last year. Just get with your contracting team and we can add that state for you. Also, beginning January 1st, 2026, Ambetter will no longer be offering plans in Detroit. So just keep that in mind if you're writing any of that business there. And that's about it. That's all we've gotten so far. If any more changes come, I always let your team know right away. But that's it so far for this year. But reciprocity, this is what sets Ambetter apart really from the other carriers on the marketplace. Does anybody know what I'm talking about when I say that? Okay, good. So this is new for everybody. So reciprocity means, let's say you're writing a policy out of Arizona for a family, And if they have a kiddo going to school in Tennessee, they can use that plan in Tennessee just like they would use it in their home state. So they can go see a primary care provider, they can see a specialist, they can go to urgent care, all of it just as if they're in their home state. So that's very different, right? Because we're used to seeing that traditional HMO on the ACA marketplace. So Ambetter does give you a lot of flexibility. Also, a big point to mention is you don't need referrals for specialists, which is huge, especially in today's market. Lots of questions, go ahead.
So with that reciprocity, do they have to go to college or can they just?
No, I just use that as an example. Yeah.
I know college is specific.
So if you're traveling or if, snowbirds, it's big for them. But yeah, you can use it in other states where other plans, you travel out of state, something happens, your only option is emergency room.
Is there like a specific network within that state?
Yes, good question. I'm glad you brought that up. So our Premier Network, and I am going to talk about this a little bit more in a second, but our Premier Network, so if you see our plans and it doesn't have value behind it or select behind it, that means it's our Premier Network, and that allows reciprocity. Now in some markets, not all, but in some markets we do have other networks where we have a value option or a select option. That is a more traditional HMO that's not going to allow them to participate in reciprocity, and they also need referrals. So just keep that in mind when you're enrolling people.
Does reciprocity count towards California?
No. So they're on a completely different billing and claim system than the rest of the company. And again, we just love to confuse you. But completely different billing system, so they can't participate. I can't contract for those states, nothing. Okay, so that's what I'm going to share about reciprocity. Let's move on. Just going to touch real quickly on renewals and the timing of everything. In September, renewal letters are going to be sent notifying the members. If their plan has been discontinued, those will go out in September. In October, renewal letters will be sent for members with plans that will continue. And then in November, all the renewal letters can be accessed in the broker portal only through open enrollment. Okay, so this is touching a little bit more on what I mentioned, the Premier Network. Okay, so the Bronze, Silver, Gold portfolio, also referred to as the Premier portfolio, has the following key features. It is the broadest provider network, so that is the one that does participate in reciprocity. It's available in all Ambetter Health counties. So when you go on your broker portal or when you go to ambetterhealth.com, there is a list of the states, and you can see all of those counties represented. And then members can visit any in-network provider and no referrals are needed. And again, this is just on the Premier Network. So not to be confused with Value or Select. Adult vision and adult dental buy-ups are available on many of those plans. And reciprocity exists in all states except California and New York. Okay, I love 24/7 care. I know a lot of other carriers have talked about this as well, the virtual visits that you can do. We use Teledoc Health. It's just it's 24/7, any time of the day, anywhere you're at in the country, you can use this service. I love it. I've used it many, many times for myself and my kids. Who wants to go wait in a waiting room when you're feeling sick? You can get most prescriptions prescribed right over the phone. With these visits, they usually call you back within 1 hour, and you can get it done. It's great. I get one of those little telescopic things that can look into your ears. You can get them on Amazon, and if you take pictures and send them into the doctor, because before that, my daughters had ear infections a lot. They always asked for pictures. Got one of those, started sending in pictures, and they would prescribe over the phone for that too. So it's really, really great service. Okay, so I really want to talk about our broker portal. It's probably one of the most underutilized tools, and I mean, not to brag, but we have a really good one. Our broker portal is very extensive. It does a lot, and there's a lot of tools in here for you. So this is what it looks like. How many people are selling Ambetter currently? Just so I can get a good feel. Okay, quite a few of you. And are you guys utilizing your portal? Show of hands. Okay, a little bit less. Okay, so if you go to your home page, this is what it's going to look like. Okay, and
there's a lot that you can do here. So obviously your entire book of business with us is here. You can easily download, sort, export to a CSV file your entire book. And that's going to be at the top right in your portal. You can download. You see that little down arrow. So you can really keep good tabs on your whole book. Also, when you jump into any individual policy, it opens up all kinds of information for that client. So you can see what their premium is, if they have tax credits, what their member responsibility is. It'll tell you the plan name. See how that says and better silver? Because there's no value or no select behind it, that means it is a premier plan. Also, dependents will be there. If they've enrolled in My Health Pays, which I'm going to talk about here in a second, you can see if they've done that. This is a great way to go back and touch base with all of your clients to make sure they are enrolled if they're not. ID cards. How many times do you guys get phone calls about ID cards? You guys can print them right here and you can send them off to them if you need them quickly. And then also a new feature that came in last year was auto pay. You used to not be able to set up payment for your clients, but now you can. So you can make a payment or enroll them in auto pay right from the broker portal. Okay, so at the top of your screen when you're in that portal, lots of quick buttons. You can do a quick pay where you can access a one-time payment for a client. You can enroll a client. This is going to be mostly for like your off-exchange stuff right here. You can find a provider right there, all within your portal. Okay, so just to kind of reiterate some of the things I said, renewal letters will be available in the broker portal in November. You can go to your policy list and click the policy ID. You have payment options. Brokers can make a one-time payment or set up recurring auto payments for your members, all from the broker portal. So if you haven't jumped in there, hopefully when you go back to your offices, you guys can poke around in there. The resource page in here. So at the top of your screen, you'll see some different options. There's a button that says resources. So much good information here. Tons. Broker releases are in here. There's forms where it says training materials. There's tutorials. There's information on all the plans. Every single plan is in there. Reference guides are, how to market. Broker social media guides. There's pre-done like social media stuff you can put online for free. There's flyers you can use if you do in-market events, things like that. All kinds of stuff in here. Almost every tool you can think of is in your resources page. And then for marketing materials as well, there's bilingual stuff if you guys are working with bilingual customers as well. Also in here, in the training materials under resources, you'll hit training materials. This is what it looks like. So you can see all the various things that are available. If you have questions about family glitch, it's in there. This will be updated for 2026, but 2026 top reasons to sell, I love that. It breaks down for every single state. So especially for you guys, when you're selling in multiple markets like you are, it's hard to, obviously you can't remember every hospital network. If you pull up that 2024 top reasons to sell, scroll to, let's say, Texas, it's gonna pull up a one-page sheet where you can walk down that with your members that you have on the phone, and you can talk about the network. You can talk about all the things that they need to know for their plan. Really, really great tool. What else do I see on here? On the second one down, 2024 broker guide, that has every bit of information you would need as a broker. Rules, regulations, all that stuff is in there. And then our Finder Provider tool, we just updated this recently. It's so much better. It was a little clunky before. I felt like it was kind of hard to find specific areas. And now they've cleaned it up. It looks so much nicer, but it's very counterintuitive. It's just very easy to use. I used Brandon, Florida zip code here as an example, but you just go in, you type in your city, your county, or your zip code, and then it's gonna ask you which network you participate in. So again, not every state offers various networks, but usually you're going to be dealing in the Premier network. She'll choose that. And then it breaks it down very easily for you. So if you have an MPI number, you can type that in. Or if you're looking for a facility or a group name, you can type that in. But then if you're just looking for, hey, I just need a dentist, I don't know the area, or maybe you're traveling and you need a pharmacy in the area. Just really simple tool. Okay, I love this program. This is our incentive program. So I want to touch on this because also an area that we don't see as much participation as we should see. And if you are currently selling Ambetter, this is a great way to go back and touch base with your clients and make sure that they are leveraging this with discounts and money that's on the table for them that they probably don't even know they have. So members can earn up to $500 in rewards for doing things that they're probably already doing, right? So for annual exams, for immunizations, for things like that. There's an onboarding and wellness survey that they can do. There's all kinds of things that they can do to earn points. And those points then convert to dollars, and then it's loaded onto a debit card for them. Now, here's my disclaimer, because we had a lot of people, and these are the fraudsters out there, going and calling people up and saying, hey, if you enroll with me, you're gonna get a preloaded Visa card with money on it. That is not what this is. That is not how we wanna explain this to people. Once they get the plan, they now have access to receive rewards. It's just a benefit. And it's also a great retention tool, because if they're receiving money for free, then why wouldn't you stick with the plan? You can also use this card to pay premiums, except for, if you see the little bottom of the screen here, except for in Arizona, Nevada, and California. Those are the only places you can't use it to pay premiums. But hey, if somebody wants to use this card and pay their premium 1 month, or maybe they want to pay their utility bill, it's a great little perk and a little incentive. And just for onboarding, you can see how the points convert. They'll get 500 points, which is equal to $50. So they can do this right from their member app. Another program that we have is with Abenity, and this is our discount program. So just by being a member, they'll get rewards and discounts for all types of things. So gym memberships, gym equipment, there's like digital fitness classes, healthy eating services, all kinds of stuff that they can get discounts for. And you can see once they go into their member portal, they'll hit rewards and then member discounts, and they can sign up for these as well. So all kinds of little perks that you can use to go back and touch base with your clients and make sure that they're leveraging their account. All right, so it's very easy to search a drug formulary with us. AmbetterHealth.com is kind of your source for a lot of things. Really quickly, they could go to, for members, look up drug coverage, and then it's going to pull up the formulary. And for this example, we used amlodipine, probably saying that wrong. And then you just, it's going to pull up the whole formulary in a PDF form, and you just do a Control F, and you can type in any drug that you're looking for, and it will tell you everything you need, and it will also tell you the drug tier. So that helps, helps you figure out what the cost is going to be for the member. Pharmacy. Same thing with pharmacy. I mean, everything is just really easy to find, and we really, really want to push people to use their member portals, to use their member app that they have available to them, so that they can have access to these tools and easily find this stuff on their own. But it's going to be from their member portal. They can go to pharmacies and they can quickly find which pharmacy is in that area. Okay, member experience is also obviously very, very important to Ambetter. And so we did launch our new mobile app last year. I highly, highly encourage you to start training your members to download this app right away. It's going to limit the amount of calls that you receive. They have everything at their fingertips that they're going to need. It's no different than downloading Facebook app or Instagram or something like that. A lot of people I hear, oh, I can't do it, I don't know how. It's so easy, you just download the app, away you go. And you know, you see a lot of information here. They will have their ID card available to them. How many people get nonsensical calls about ID cards, right? It's all at their fingertips. It's right here. If they want to select a new PCP, they can do that in here. If they want to make a payment, if they want to enroll in auto payment, they can do it from here. They can see claims information. They can search for providers, everything from the app. Very simple. Okay, so this is, you might want to take a picture of this. These are the contacts that you will reach out to if you guys have questions, in addition to myself. But we have different teams that do different things. Our broker sales support, they are your definite go-to for most things that you guys are going to need. So if you need to research a member inquiry, anything regarding members, like maybe their enrollment status or you know, agent of record issues, things like that, or you have a question on your commissions, you guys will probably go to your commission team here first. But if you need help with your broker support tool, any of that stuff is gonna go through our broker support team. I'm more contracting, so when you guys add new states, that's gonna come to me. I work with Agent Boost on more high-level strategy, things, marketing, ideas, things like that. But of course, I'm here and available for you guys if you have questions as well, but very important. And then member services, it does vary by state. So the member services number will be on each individual card, but there's a different number for each state. And that's me, I'm your account executive. That's my email, there's my number. If you guys need anything or have any questions, or is there anything that you want me to touch on that maybe I didn't cover? Okay, so more to come. Like I said, stuff is still rolling in every day. We're getting new information every day. So because of that, because we don't have information on commissions and bonuses and hot markets and all that yet, we are gonna do 2 virtual training sessions. One is gonna be October 15th at 9 a.m. Pacific Standard Time, and then October 21st at 1 p.m. Pacific Standard Time. So I'll be working with your team and getting that information, those invites out to you guys so you can jump on, and we will have a lot more information that's more specific to Plan Year 26. That's all I have. Are there any last minute questions? You guys are too easy. All right, thank you so much.
Thank you, Nicole. We appreciate you. She's always awesome to answer questions and help you with everything. So if you ever need help, reach out to her. She's been great. Our next presenter is one of our newest partners. It's
Harmony.
Harmony.
I get that all the time.
Sorry, I know it even. Harmony with Oscar Help. They are not here in Utah, but they are the #2 ACA carrier right now, behind Ambetter. That's not why we lined them up one behind the other, but that's okay. They are available in Arizona. Is a good market for them. She'll have the whole slide for you. So if you're selling outside of Utah, they're one that you definitely need. So I'm gonna come on up and we'll get you all set up. Technical difficulties, hang on.
Well, I'll just introduce myself while we get going. You don't really need to see the first couple slides. So good afternoon, everybody.
My name is Harmony. I first want to thank Agent Boost for your partnership and believing in Oscar and for having me today. We are very excited about this partnership and I look forward to doing business with you all. So a little bit about me. I am the Midwest Sales Executive. I'm coming to you all the way from Columbus, Ohio. OH, anybody? Yeah, okay, cool. I didn't know how far away I was. But, so I joined the Oscar team this year with about 2 decades of healthcare experience from the provider side all the way through working as a broker for individual, family, and employee benefits nationwide. I have a master's in health administration, and I was working to complete a Doctor of Health Science degree when I had my own health problem. So a lot of people in the health insurance industry share similar stories about something that happened to you or a family member that might have given you a why as to getting into this business. So mine was, I was working for the Ohio State University Wexner Medical Center. I was managing several ambulatory care facilities, the billing, all of that. My insurance was through OSU, and I had to have a surgery at OSU. And I walked out of there about $50,000 in debt, and I had no idea why. And if someone with my experience and education didn't know why, my mind was just blown. Who could know then, if not me? So I ended up hooking up with an individual provider, or an individual broker like you guys are. And in about 45 minutes, I'm embarrassed that I spent all those hours in college and all that money because he taught me in 45 minutes way more than I had ever learned. So what you guys are doing is so impactful. I called that guy up the next day. He worked for Health Markets, and I said, I want to learn to do what you're doing because this is so important. I know a lot of you probably have similar stories, so just pointing out that what we do is important.
Jordan, what'd you do?
There we go. All right, we're up and running. Okay. So there's my picture. Not that you can't already see me. So again, my journey and experience leading up to working for Oscar has given me a lot of respect for what Oscar is doing. Like I said, I was a broker for about 12 years working with all the different carriers, and I've been very impressed since I started with Oscar. Our internal communications, interdepartmental meetings, all of that, we're all in on it, and we take the feedback from brokers like you back to our team all across the board. Our mission, make a healthier life accessible and affordable for all. And that completely sums up my own personal, professional motivation. Everything we invest in should improve the member experience, and that means taking care of our brokers and providers, of course. Unlike everyone else, the ACA is all we do. So our A team is working to improve the market every day, and we're focused on doing the right thing for our members. So for 2026, Oscar is available in 20 states with industry-leading product offerings. So Arizona, Florida, Georgia, Iowa, Illinois, Kansas, Michigan, Missouri, North Carolina, Nebraska, New Jersey, New York, Ohio, Oklahoma, Pennsylvania, Tennessee, Texas, and Virginia, and this year new is going to be Alabama and Mississippi. So Oscar represents 1 in 12 ACA members across those states, and we're the 2nd largest ACA carrier in the nation, which Heather was so kind to point out. We've now grown beyond that little startup you may have heard about in the 2010s to a Fortune 500 company. And in just the past 4 years, we've doubled our membership to over 2 million members. We were 84% broker-driven in 2022, and we've climbed to 92% broker-driven in 2025. So we are big, and we have strength. Oscar is an industry leader in Net Promoter Score, or NPS. This is a metric used to determine how much a member would recommend Oscar to their friends and family. And that score ranges from -100 to +100. Big surprise here for you guys all. Health insurance companies are not known for good experiences. In fact, the industry average NPS score is 0. Oscar is very proud of our NPS of 68. It speaks to the fact that we are delivering on our mission statement and we will continue to be proud of that fact that the majority of our clients would recommend us. A little bit of context. Companies known for having happy customers, like the Apples, the Adidases of the world, they're well below our NPS score. And among our Spanish-speaking members, we have been able to grow our NPS even higher to 88 as we work to provide services across the board in Spanish. We are continuing to focus on providing brokers with best-in-class training, tools, and resources. And we know that brokers are key, of course, and we want to be a resource for you all throughout the year. We want to be the go-to carrier and show you how much we appreciate your business. Oscar will continue to invest in you by staying on top of important issues like CMS changes and pushing that information out as things are finalized. We have an entire webinar series on our website devoted to regulatory updates and education, and we will continue that. So our focus on the member experience is designed for ultimately broker ease and efficiency. So through our app and our focus on technology, we have proven results with our highly engaged members. So those engaged members, let's say you enroll a client, they download our app or they utilize our care team. They are then more satisfied, leading to higher retention and an efficient, easy book of business for you. So it's important to note that we are high tech, but we're even more high touch. We're making investments in technology that reduce operational costs and improve customer service with fewer phone calls and information that is readily available digitally through our app. But we're also still doing all the things that you're used to as well. Our tech focus provides streamlined processes that enhance and expedite the user experience, but we do not sacrifice the important personal touch of human engagement. There is a video. Let's see if it's going to play. I was afraid of that. Okay, let me play it through my laptop, and I'll just put the microphone and see if you can hear. This is just a testimonial I think is valuable.
Some insurance companies feel like so intent on processes they forget that members are people. So it really helped me navigate in a sensitive health situation with one of my children. The care team person that reached out understood the dynamics that are at play with that specific situation. Having that support from Oscar gave me confidence in the decision to help my child.
Okay, so I think that's a really important testimonial. Anybody who has sold Oscar has probably heard similar testimonials to that. We're very, very customer focused. So ICHRA, Oscar is the clear leader in ICHRA nationwide. If you're not presenting ICHRA regularly now, first of all, you should be. But Oscar is here to provide the training and support to make it an easy option for your employer clients. A quick overview, hopefully this isn't too, I'm not just reiterating what other people have said, but and ICHRA allows employers to give employees tax-free dollars to use on health insurance premiums or other qualified medical expenses. It helps employers manage costs while employees have the freedom to shop for an individual market plan that best meets their needs, as consumers do in nearly every other part of the economy. Isn't it kind of weird that we're asking an employer to spend all of this money, choose maybe 3 plans that they think will be best for their entire workforce, and then those people additionally pay money for those benefits that they might not even be useful to them. So ICHRA gets employers out of managing benefits and empowers the employees with choice. We have partnered with all of the ICHRA platforms very closely to streamline this process across the board for employers, brokers, and members. These platforms allow for a similar experience to a traditional employee benefits offering from the employer perspective. There are various benefit selection tools that brokers can use when they're enrolling to make money and do less work, which is a win-win, right? And then the members get the chance to choose the right plan in their community that suits their personal and family needs. I know when ICHRA was first introduced, we used to, just my little agency, we used to say ICHRA is icky because it's complex, feels complex, especially explaining it to an employer. And at the time, we do all that work, and then you might not even get paid by the carrier, right? So it's like, what is my incentive to do this? We have many training resources and platforms to choose from. These platforms really do vary. There are platforms that they'll let you stay more high touch, you want to be involved. Others that will maybe take the BOR for you and take over those things, and then you can embed in a broker fee. Some of them will take the money from the employer and pay directly to the carrier. Others will have the employee pay and then reimburse. So there are a lot of different options out there now. And we can make those introductions and recommendations so that you can choose the best option for you and for your employers. We have a dedicated ICRA team, and we encourage you to use us as a resource. We are more than happy to come in and present to your clients with you if that makes you more comfortable, if it's something that you're just not really familiar with yet, you don't know how you're going to answer questions. We'll bring the platform on. They are all also very highly knowledgeable. We're here for whatever you need, and we want to make ICRA an easier option. So, Oscar is leaning into the changes. Part of playing the game, right, includes all the things that will happen in the industry and the government, a lot of which is out of our control, although Oscar is highly involved in the legislation. But we are focused on doing the right thing. So I do have physical copies of our essential guide to the final CMS program integrity rule at the Oscar table out in the lobby. You can also download that on the website. Since spring, we have been trying to equip the broker community with as much information as possible. Like I said, you can watch all of those regulatory webinars that are on our website, and there will be more to come as well. And as it continues to change and evolve, we get closer to open enrollment, we will continue to push that information out to you. We've been planning for marketplace integrity rules. Of course, nothing is finalized yet, but I'm going to go over some illustrative changes that could happen that Oscar will stay on top of as things evolve. So income, you need to look at what it is today versus 2026. Taxes must be filed, and there's now 90-day document submission deadline. 2 reminders just to kind of call out again. None of this is finalized, but this is just giving you an example of how Oscar is preparing. Under 150% FPL is no longer an SEP, and passive renewals who fail to verify their eligibility will be subject to a $5 per month effectuation premium payment. And this is just an example of walking you through what this might look like for your clients, depending on how things are finalized. So this is a quick example of what we currently, or as of yesterday, know about the $5 monthly premium. So this is your client, Mark, from Florida. He's paying $0 for his 2025 Bronze Elite plan on an FFM. Mark has 3 options. Option number 1, he can verify his eligibility and his APTC will be reinstated for 2026. Option 2, Mark is going to pay $5 per month for all of 2026, and he does not verify his eligibility. Option 3, Mark takes no action and does not pay the $5 premium, and after 3 months his coverage may be terminated and you, the broker, may not receive commissions from Mark. Didn't Heather say that wasn't a thing anymore? That's why it could be, that could be something that has just changed. Put this presentation together, so. That will all be updated in real time on the website though. These examples will be there, corrected as things change. The good news is, Oscar is taking the lead to ensure a successful OEP by supporting our brokers with important prep checklists. The key here, of course, is to make sure that you're getting to your clients early and educating your prospective clients on how to ensure a smooth enrollment. We don't know exactly how things are going to go, but you should be touching those clients early just to make sure that there's no interruptions. Whoa. I don't know what happened to that slide. Kind of weird there. We have an abundance of regulatory updates on our website. If you can scan that QR code, got a little wonky there, but that is, you can also get a physical copy at our table as well. But hioscar.com has all of our important documents, upcoming and past webinars, comparison tools, and FAQs. We see change as opportunity. So when carriers exit, that's an opportunity for us, and Oscar is leaning in as the solo ACA only carrier. As Aetna exits, Oscar stays. So we will have planned grid mapping for individual areas coming soon for all Aetna clients that you need to move, as well as reference comparison one sheets for visual examples. Rate grids for 2025 are on the website now, and we are of course going through the latest rate filing with everyone else, so we will notify you through Agent Boost when final materials do become available. And we'll be pushing out heat maps. I know a lot of people who have come to my table have been asking about that. We'll definitely be pushing those out for our most competitive areas, and all the extra info and guides as soon as that information is available. Condition-based plans. Anybody sold condition-based plans ever? Cool, okay. So we have developed condition-based plans to meet members where they are in their health journey. To meet the growing market need, last year we introduced our COPD, diabetes, and chronic care plans. Those were very well received. And now this year we're introducing a women's menopause plan. So just a quick highlight of those plans. We have a chronic care plan. It combines multiple conditions, including diabetes, COPD, and cardiac care. Our COPD plan treats asthma and COPD, diabetes, and then our new women's health menopause plan. Each day, approximately 6,000 women in the United States reach menopause. And it's important to note that alongside these condition-based plans, Oscar is going above and beyond and providing tools, education, and specific provider support for those members to learn how to better manage their health care and better understand their condition. So here's an example for you of the women's health menopause plan. This is just illustrating how a woman and her whole family can take advantage of this plan. That right column, PCP Simple Saver, is an example of a copay cost share on the Like Silver plan. So you can see here the Oscar plans include $0 primary care, mental health, additional clinical benefits specific to benefit design. So conditions that these members are dealing with, like bone density, gynecological visits, hormone replacement therapy, these things are all addressed and prioritized, and you can see similar things with each of our condition-based plans. This is just a quick highlight of alternatives for best suited options. You can see our 3 metal tiers are also distinguished by Oscar's plan suites, which are the Simple Saver, which is designed for those looking to save money on their healthcare coverage and want just-in-case protection. The Classic, designed for those who are not regular utilizers, but they want predictable copays for their most common services. And the Elite, which is designed for those who regularly utilize care or take medications and want predictable copays. These materials will be available, and they will be available market-specific in the 2026 Sales Toolkit for reference during open enrollment, pending final approval, of course, and we will be sure to push that information out through Agent Boost as well as our provider portal. Again, we rely on brokers to put people into the right plans. So we've worked really hard to incorporate technology and top-tier support for our brokers and your clients. So if you're not familiar with Oscar and you're moving clients this year, we have the best tools to manage your business. So you should feel very comfortable moving lives to us this open enrollment. 4 out of 5 brokers recommend us, and I get feedback all the time, multiple today alone, that brokers wish they could have all their business with us because we make life so much easier. If you haven't checked out our broker portal lately, if you are appointed, if you're not, get appointed, because I highly recommend that you do. Our dashboard shows clear key actions that are recommended both across your entire book and also with individual members. So we have a new scoring system that's going to help you focus on priority tasks using key metrics. And then we have a one-on-one view that will streamline your personalized communication with your clients. You can see things here like overdue policies, and then you can auto send reminders to those clients. You can view additional metrics like those that have auto pay turned off and how many policies that you have that are at risk due to no premium payment. We want to make open enrollment easy for you. So within the portal, you can see all the important insights like members who are likely to require income verification, or book trends to better manage your time and bandwidth, and a quick help center with guidance and support. And we now have a broker toolkit on our website, and you can use that toolkit now all the way through the year for attracting, retaining, and informing members about all things Oscar. So plan comparisons, network one-sheeters, essential guide, commission schedule and bonus information, that's an important one, member communication examples, social media, flyers, email templates, and retention mapping guidance. We developed this one-stop shop in an effort to find more ways to make life easier for you all. Nationally, of course, everyone has said this over and over, right? We're still waiting for final rates, just like everyone else. But once they're public, we're going to blast that out through Agent Boost, highlighting where we expect the highest growth opportunities. So, on behalf of Oscar, I want to thank Agent Boost for your partnership and having me here today. We know that what you all do and what we do is a big deal. Get on our website, you'll see what we do is a big effing deal. Our CEO's big on that. And so we thank you for allowing us to grow and succeed with you. And I, again, cannot emphasize enough that we have such a wealth of information and tools on our website and in the broker portal. We will continue to be your best source of information as we move through this 2026 open enrollment season. And we do have national, virtual, and state-based open enrollment webinar series, so you can jump on and see the schedule for those. If you're selling in different states, you'll want to make sure you jump on those. They'll have all of the highlights. Pointing out here, get appointed. Do it. Broker support is available by email and phone, and I've also included my contact information here as well. Having been a broker, I know how frustrating it is when you're trying to get in touch with a certain department within a carrier. Come to me. If I don't know the answer, I will get it for you. I think that's so important. I don't pass the buck off to a bunch of other people. I specialize in Ohio, Michigan, Illinois, and Nebraska, as well as several of our national GA partners. So I'm always happy to be your point of contact. And I'm happy to address any follow-up questions and discussions back at our table. Anything individual you guys would like to discuss, I'll be here for the remainder of the day. So thank you.
All right, next we have AJ, known as Aaron, obviously, on his email, but very excited to have him come speak, especially if you're wanting to sell out of state in Utah. He's going to go over leads, different programs, things that made us really successful in our own internal call center, as well as agents that we support around the country. So as soon as he's ready to go, we will pass the mic on over to him.
Yes, dear. I don't know. I need to find out.
What are you looking
I'm having these terrible problems.
Well, I'm not. What do you want to do?
That is me. That's politically incorrect to ask me that question.
I know. But you know what? It's you and it's me. I don't care.
I could say I'm offended.
Yeah, you could.
I think that's a hate crime.
Yeah.
piece of business, it'll show the numbers aren't necessarily going to match up with what goes into effect, but it'll show you what business they submitted and what carrier. So, hey, looks like AJ's ready to go. I'm going to pass over to him.
Hey everybody, good to see you all. I'm AJ, Director of Marketing here at Agent Boost. Pleasure to see y'all. Some new faces, a lot of old faces that we've seen in the past, so happy to see. We're going to go over leads and how to market AEP, OEP. You guys have been getting a lot of information the last couple of days about all the different carriers and their plans and their target markets, and where they're going to be good, where they're exiting, and so forth. So just keep that in mind as we go through all this, because I'm going to rely on you guys, because I don't know where all your licenses are and where you want to target, what carriers you want to target. That's a conversation that we can have at a later time. So this will be a little bit more general information on how leads are generated and where we get them from and all the different options that you do have as it relates to the leads. And then I'll have an email as well as a QR code if you want to schedule a call with me. We can go a little bit more in depth of, okay, I want to sell United Healthcare in this particular area. Let's take a look at the map. Let's take a look at what plans are available in those areas, and let's target by county, let's target by zip, and kind of specialize that plan for you guys individually and what's going to make sense for you. This will be Medicare as well as ACA, so just keep that in mind as we go through all this, a little bit more higher level overview of how the leads come in and the different avenues that we can get them from. Cool? So we'll start with one of the big things that's going to cost the least amount of money but the most amount of time is going to be getting your own brand out there in the market. A website, Google My Business profile, whether it's an actual brick and mortar shop like we have down in Mesquite, or you're at your house, that's okay. We can hide your address and you can still have a Google My Business profile, which is going to target your local areas. You can have your local county and county surrounding, so that way when they type in Medicare or ACA or marketplace insurance, you're going to have reviews, you're going to have those keywords on your Google My Business profile, so that way when your local consumers are searching for those particular items, you're going to pop up as one of the local services in that area. So that's one quick, easy way to have that local presence in your community. And by doing that, all you need is a website, an EIN, and register your business with Google. And you'll get a Google My Business profile, just like you've probably found this building. You typed in Agent Boost address. If you haven't been here before, you saw that listing. That's exactly what it is. So that's a quick, easy way to get you in your local area, in your surrounding community. Then on top of that, it's going to be, okay, we have a website linked to that Google My Business profile, and you're going to dive deep into the products that you sell. Whether it's a blog post or just information of how to get Medicare, parts A and B, C, D, E, F, G, and that's right, it's a good song. And so then you have your blog post about those particular products, which have those keywords, and then as their consumers doing more research with your Google My Business profile and your web presence, that's going to be another route for you to get organic traffic to your CRM phone number or whatever phone that you're using, because hopefully they're all recorded for compliance purposes. And then once you have the blog posts are getting organic traffic, you have optimized landing pages, so that way you'll collect their information, so that way you can outreach them and continue on that conversation with them. And then, if you want to do your social media, posting about all the clients that you helped, your reviews that you just got online, any sort of tidbit of information that you find working out in the local area and people don't know or frequently ask questions, it's a good way to get your social media profiles going and giving that information out to the consumers, to them another avenue to pitch your website and give you their contact information so you can reach out to them. So that's going to be the branding in your local market. And then once you have your local market and you have a website, this is going to be the other avenue that you have to get consumers to your door, which is going to be through your Google Ads, Facebook, Meta, more or less, LinkedIn, and just paid advertisement to your website. If you have, a few $1,000s that you want to spend, this is a good way to do it. Sometimes it takes a lot of money to make money as it relates to Google Ads as you figure out the process. It's not for everybody, but it is an avenue for people to do it. We have a media buyer in-house here. We're generating around, give or take, 200 leads a day in Medicare through Google and Facebook. Those are available to you guys as well if you're interested in that. And we might eventually have an option to run ads on your behalf. That is kind of in the works. So if that is of interest to you as well, that's something that we could be offering here in the near future. So that's paid advertising, paid traffic. Then your affiliate is going to be other websites out there that aren't necessarily related to health insurance, but they're in the same type of realm of insurance. Like, let's say, pet insurance for whatever reason. That's a cross sell to, you need pet insurance, you think about insurance, maybe there's a Medicare ad or an ACA ad that you could throw on that website. Say, oh, I didn't think about that. So they would drive that consumer to your website, fill out your form to get more information about whatever insurance that the ad was for. This is more towards like high volume type websites. If you pay people to drive more traffic to you once your Google and Meta ads are kind of maxed, you can then continue to find other avenues and different target demographics from different types of websites to get to your website and fill out those forms. And then this is going to be one of the things that we're really leaning into this year as we go into AEP and OEP for the ACA market is partnerships with providers, dentists, primary care facilities, psychologists, optometrists. Because if you can get to, a lot of you guys know this already, but if you can get to the provider, and the way that's been described to me, this is fairly new to my world, so bear with me. But, for example, if someone goes to the doctor, they have to help the person that's there. But if they don't have insurance, they're not guaranteed to get paid for helping that consumer, right? So if that doctor can refer them to us, we can get them insurance. Now the next time they see them, they have a guaranteed payer because they have insurance. And they're not going to lose out on that money. So partnering with some of these local providers in your area, they could send you referrals and you work that way, especially in the ACA space. Medicare, that creates a lot more legality and issues. ACA, not so much. And so we're really starting to lean into this, and we're going to start going around and trying to find partners and providers to give us referrals and have a rev share or a referral fee, whatever. It's up to you guys on how you want to partner that way. But this is one way that we're going to target with the ACA, because as you guys know, inbound phone calls and leads, there's only a certain amount of people that do that. The other people are going referrals from friend to friend, going to the doctor, and might need assistance. So instead of doing the top 20% of inbound phone calls and leads, we're going to tap into the other percentage of people that aren't actively shopping all the time. Does that make sense? Cool. Which will also be good on your book for sustainability. And then, kind of like I was mentioning before, we're going to start moving into full web service management here in the near future, where it will come at a monthly fee, anywhere from, $300 to $700. Build your website, manage your website, social media posts, blog posts, your Google My Business account, and reputation management. So that way, you have a website, you have social media posts going out, you have a Google My Business, we'll design your logo, and then we'll also respond to your reviews and so forth. So keep an eye out for that. That's something that we're going to be doing in the future, so that way it can help you in your local areas, as well as help build your reputation and get those reviews, and even be more of a power in your local community. Any questions so far? Sweet. This is kind of what we offer at the current moment. The Facebook and Google ads, those are going to be internally generated. Like I said, we're doing about 200 a day right now. So we don't have a ton of supply, but we got supply. And we can bump that up pretty quick. We're not at our cap by any means. And they're anywhere from 10 to 15 bucks per lead, depending if it's Google or Facebook. Google's a little bit more expensive than Facebook because it's keyword based, and when you're working with, competing with, the Transacts, the Select Health, the Go Healths, all the carriers as well, with those particular keywords in Medicare Advantage or competitive keywords. So a little bit more expensive. We also have in-home appointments that we can work out for you guys, where the scope's done, they already know what carrier they're with, who their primary care provider is, and a couple other items on that list. And you show up to the house, and you have an appointment, and you write a policy. That's $100 a piece. Third-party affiliate leads, anywhere from $4 to $15. It's probably more to $4 to $8 on any given day based on your geos that you're looking for. Are you looking for 5 to 6 counties in Utah? Probably towards the $8 mark. If you're looking for full states of Texas, Arizona, Florida, Oklahoma, you're more towards the $4 to $5 range. And those are off our third-party trusted websites. And we have inbound live transfers, inbound phone calls, consumer-initiated, and live transfers, which is an outbound to a live transfer, or a consumer-initiated who just called something off of Google and hit your line. Those are each $35 per call on a 90-second duration, meaning you have 90 seconds to qualify that consumer before you're billed for them. If you hang up at 88 seconds, you're not billed for that call. You move on to the next. And then you guys have probably all seen it or heard about it. We have ACA and Medicare for our dialer, which is $2.99 a month. You get unlimited outbound leads. Have 100 conversations a day if you like. Then you also get the overflow inbounds, which are the two that are mentioned above. Sometimes we have agents that aren't available. They're on break. They're on phone calls. They're not here today for whatever reason. We don't want to miss that call. So anybody who is available, who's not our top priority, will then get that phone call as long as it's in their state, and so forth. So you have opportunities to make outbound phone calls, grind through the day, and get some inbounds. This is going to be more for if you have time and not a ton of money, this would be a great option. You get to have a lot of conversations and get some inbounds. Have people in the dialer on a daily and monthly basis, writing anywhere from 30 to 40 policies a month through the dialer, working 5 to 6 hours a day in Medicare. We have people who are doing 5 to 10 ACA a day, going through the dialer. So it's a good opportunity there if you're willing to put in the work and do some outbounds and take the opportunities when they come. Any questions here? There's my email. Here's your QR code if you want to schedule a call with me. Talk about all the different options, the markets that you want to target and shoot for, and we'll kind of devise a plan and figure out what makes the most sense for you. If you don't know the dialer option, then all the leads will go to your CRM, and you have your text messages, your workflows, and that'll be the outreach for them, and you receive however many you want in a day, basically. Pretty simple, easy to set up. Really just want to focus in and be strategic on where you're targeting, who you're targeting, and what carriers you want to write, because we've got a lot of disruption going on, as you guys have been hearing. Non-commissional plans, all that fun stuff. So we have a plan, but I'm waiting for the next 2 weeks to really solidify where we're targeting because of all those disruptions that are going to be coming out. We've had one yesterday, maybe one today, as far as non-commissional plans go. So still up in the air for where we're going to target, but with disruption, there's good opportunity to take advantage of. So we just want to be strategic when we do that. That way your marketing dollars go towards sales and not waste. Any questions?
So if I have a person doing the website stuff now,
Yeah.
is that a huge transition when you guys are on?
Depends if it's WordPress or what's it built on. I think it is WordPress because we had that conversation, right? Yeah, it would be fairly easy, but yours is a little bit different circumstance because of how it's set up. But we'll have that conversation. But yeah, absolutely. Yeah, but yeah, absolutely.
With the Google ads that you mentioned, is that like you guys help us like set up our own Google ad campaigns and we just pay per click to Google, or is it something where you pay per lead through Agent Boost?
So right now it would be a pay per lead through Agent Boost because what's happening is we're driving it to our website and generating that lead. If you have a website and a Google or a Google account, we can assist and help and help you with best practices, but as managing that account for you on your behalf, we're not quite there yet. That is something that we're looking to do in the future. But right now it would just be buying what we are generating as Medicare advocates, if you will. Any other questions? No? Sweet. You guys have a great day. Thanks for coming.
All right, looks like we have a break right now.
15 minutes.
15-minute break.
Yep.
So, 2:15.
Yep, be back at 2:15.
Okay, 2:15, everybody. Thank you.
started. If you guys can take your seats, please, so we can get started. All right, we're gonna get started. Hello, we're gonna get started, guys.
Are we gonna get started?
In a minute.
I thought you said we were gonna get
Do
started.
I need to use my mom voice?
Oh, no.
Oh, don't tease those boys with that.
Yeah. The shrill voice?
Nope.
All right, so we're going to go ahead and get started. Our next presenter is Health Sherpa. So Health Sherpa, we have a strategic partnership with them. So we have one of our national reps, Jordan. She's like way up there. What's your title? I don't even remember.
Director of Agency Sales.
She is the Director of Agency Sales. So she is like right below the CEO.
Not true.
That's what we tell people. But I will just let her, she's going to talk to you about how Health Sherpa is helping you with renewals, how improvements they've made on the website, all kinds of different things. I probably mentioned this on a few webinars, but we are one of their strategic partners. So when they have questions about things and improvements that need to be done, we talk frequently. So, Jordan Cerullo.
Good afternoon. Everyone nice and warm in here?
No.
I'm shaking because I'm so cold.
You need a sweatshirt.
I have one, but I took it off for the presentation. Yeah. I didn't want to, yeah. I'll put it on afterwards. All right, well, thanks for having me today. Show of hands, who has sat in on any of the Health Sherpa trainings in the last 3 months? Okay, so hopefully some of this is new to you all, and if it's not new, I'm sorry, and you can take a nap. All right, so as Heather said, Jordan Cerullo, Director of Agency Sales. I oversee our agency account management team, so we've got a couple of account managers that work with all of the agencies across the country. We've got about 6,000 on the platform, and then my teams also work with all new agents and new agencies to the platform. So whether you're an experienced agent, new agency, or top agency like Agent Boost here, my team likely works with you in some capacity. So if you need anything, reach out to us. If you have product feedback, if you have complaints, come to us. We're here to help you. Here's my email address. I will do my best to help you or connect you to the right person if you need anything. So 2025 in review for anyone that is new to the ACA. This is not a normal year. It's been an eventful year. Is everyone familiar with what's happened this year? Because I'm not going to go through it all if you are familiar. Obviously, there's been a lot of change this year. I think the one thing that's been constant is that we're still in the wait and see phase. So we're doing our best to make sure that everybody is kept up to date on what you need to know, how you need to prepare for open enrollment. We've worked really hard on building tools to help you prepare for open enrollment, help you prioritize your book, navigate your renewals, but there's still just a lot of uncertainty in our market. So we're doing everything we can to stay close to the program integrity rules. We know that there's a pause on a handful of those currently. We know that the advanced premium tax credits are uncertain, so there's still just a lot that is up in the air, and we will do our best to notify you as soon as we know more. One of the things that I always tell new agents and agencies is of all of the emails and communications you get from Health Sherpa, you can delete as many of those as you want, but please flag the one that has newsletter in the subject line. That is where we send out any communications that are important for you to know about. Our marketing team does upcoming trainings in those. Anything industry related or from CMS will be in there, so keep an eye out for our newsletters. Those are typically the third Thursday of every month that we send those out. We try not to spam you all. So obviously we know that there's a lot of changes that are here to stay. So really our focus is it's time to adapt to this new reality. You will weather the storm, and by being persistent and working through this year, you will be successful and you will be able to navigate these changes. And we do know that we have an opportunity now to shape the future. So a lot of these changes are a result of the rampant fraud that was in this industry, and it's been a huge priority of ours to be working with CMS and our strategic partners like Agent Boost on ways to tamper the fraud and work through them so that the ACA can remain around and be a sustainable business moving forward. Also, if anybody has questions as I go, please feel free to raise your hand. So let's talk about adapting to reality. So right now we do know the CMS final rule is on pause. This was a handful of the provisions included in the program integrity rule. There will have to be some sort of appeal in order for these not to go into place for open enrollment. What we are suggesting to everybody is still prepare for open enrollment like these rules are going to go into place. If they do not, that's best case scenario for you, then you'll get a little bit of a break, but there's just so much uncertainty right now that the best thing you can do is prepare like they are going into place, and we'll continue to keep you posted as we know more. We do know that there was a appeal on one of these already, and it was the de minimis portion. I'm not going to go into detail on that, but again, these things are changing on a weekly basis, so just continue to prepare like they are going into place. So we've kind of had 3 different pillars that we've been focused on throughout the year. The first is being know your book. So really working throughout the year to give you tools to understand your book of business, understand how you would be impacted if the premium tax credits expire, adjust your strategy depending on your specific market and the clients that you serve. The next section is keeping your clients covered. So really helping you prioritize active renewals, again, segmenting out your book of business, determining your outreach strategy according to the specific risks that you have, and we'll talk about those product features. And then maximizing productivity. So this is something that I think HealthSherpa does well, but every year we're looking for ways to improve efficiency within the platform to help you prepare for open enrollment, but then also navigate open enrollment as quickly as possible. I do see that we've got November 1st through December 15th on this. Obviously, you all know that you have through January 15th on here as well. SVI documentation may not be relevant, but again, probably a good practice to start collecting that documentation if your clients have it. Okay, so the name of the game this year is prioritizing active renewals. So some of the potential changes that we have on the horizon, the expiration of enhanced subsidies. This will be a big change. If your existing book is $0 plans, you're no longer helping your client choose a plan that's free to them. You're now selling them a plan that's going to cost them something. You're collecting payment information. So definitely make sure that you're focusing on your sales strategy and helping them understand what specifically they're getting out of this plan and what they're getting from buying something when they're accustomed to something that's free. Then we've got the end of the 150% FPL SEP. Obviously this has already stopped. We do not think that this will come back as a part of those provisions that are on pause. So obviously you'll need to focus on valid SEPs throughout the year, assess the risk across your book as well. We know that this particular segment of these consumers were more susceptible to plan switching throughout the year, so really important that you're touching base with these clients, making sure they know who you are as their agent, making sure that you're keeping them in the right plan for their needs. The $5 premium for fully subsidized passive renewals, this is on pause currently, so if this remains on pause, then these plans can passively renew, but essentially if this does go through, you will be required to actively renew these clients. Just to show of hands, who tries to actively renew their whole book regardless? Yeah, okay, so I mean, it is a good practice to get through. I think, you know, it certainly helps with retention, but you know, if this does go through, then these clients, if they passively roll over, they'll be charged a $5 premium monthly. And the way to get that $5 back is on their tax return, so it's not really that easy for them to get that $15 back if those charged monthly for the first 3 months of the year. Failure to reconcile, this one, you'll just want to make sure that your members are filing their taxes. The way that this was written was previously if you failed to file for 2 years, you would not be eligible for subsidies. Now this has been changed to 1 year. This one also may change, so stay tuned on that one. But definitely you can see in the product if we're seeing a notice from CMS on whether or not they failed to file their taxes. So a conversation to have with your clients is making sure that they're filing their taxes if they're expecting advanced premium tax credits. So the DMI triggers for over a 10% income variance, this one we also are not certain whether or not this will go into place, but you'll want to make sure that you're collecting documentation for all of your members. We expect to see more DMIs following open enrollment, so we'll talk about some of the features that we've built to help you collect and store documentation on Health Sherpa. But whatever you can do while working with your clients to collect documentation, whether you're meeting with them in person and you tell them to bring that documentation, maybe you're storing it in a CRM, but good practice to get in of requiring all of that documentation up front so that you're not having to track that down later. The shorter open enrollment period was initially proposed. We know it'll go through January 15th this year, but next year we'll go back to the 6-week period. Did someone have a question? Oh, okay. So again, begin preparing open enrollments ahead of open enrollment. We'll talk about what that looks like. And then reinstituting SEP pre-enrollment verification. So this one has caused...
On the DMI trigger,
yeah.
Is it currently, I know I've seen it at 25%, and then I think under the Inflation Reduction Act, they get at 50%. We're saying 50% if this goes in effect, or you know what it's at currently?
Yeah, so currently it's less than 10%, and I want to say our estimation was that it would be closer to about 40% would hit this income threshold. It's actually on the, I believe, self-employed and lower income that tend to hit this more often. So our guidance on this was just collect documentation or use the attestations. Yeah, exactly. And we've built some tools to
Is everybody triggering now?
Hopefully not, but yeah. Any other questions on DMIs?
You said that if we get the recommendations, that we should save it on the CRM.
Yeah, so, well, if you're using a CRM and you can store documentation on that, great. We've built that functionality into the platform. I'll show that to you.
Do we have access to data at any time?
Yes. Yeah, so previously, and I'll talk about this when we get to that slide, but previously if you uploaded a document or if your client did it, it just goes directly to the marketplace and we weren't storing that. We're working on separating, there's like the application side and then the Health Sherpa side so that you can store things on Health Sherpa, you can access them whenever you need to. And really the whole point of that is if you can get those documents in the platform prior to open enrollment, if you do generate an SBI or a DMI, you already have it, and then you're not having to contact the client again saying, hey, when you get home, remember to take a picture of this and send it over to me. So some improvements to come on that. I do want to take a minute to talk about SBIs because that's been something that's been, I think, a little bit confusing this year for a lot of people. So an SBI is a SEP verification issue, and these are only required right now for loss of coverage. The way that the rule was written is that they would be required for any SEP going into plan year 26. And this is a change because these have not been required for the past couple of years. So the way that an SBI works is when it's generated, following an application, you're required to resolve that SBI within 30 days. And after you've submitted that application, unlike an application that has a DMI, the application does not go to the carrier until the SBI is completed. So it just sits with CMS until they get the SBI resolved. So if you submit, let's say 10 policies that have SBIs, and then you get your carrier commission statement, a month or two later, and you're like, why am I missing these 10 policies? It's because that file is never sent if you don't resolve those. So we've built reporting for you to be able to track outstanding SBIs, expired SBIs, completed. You can find those in your reporting in Health Sherpa, but it's really important that you resolve those within the 30-day period. And now let's say, so today's September 10th, let's say you write a policy for, I'll get to you in a sec, for October 1st, and you've got until October 10th, and you resolve the SBI on October 9th. the member is not going to have an active policy through until that SBI is resolved. But once it is resolved, the policy will be backdated to the original effective date. So just know that, but know that it may end up causing you more work if you have to now work with your member on, filing a claim or having that backdated. So just keep that in mind.
My brain's about acronymed out. SBI Special Verification.
SEP verification. So I know, I answered your question with another acronym.
SBI means what?
So an SBI is when if you have a qualifying life event, which opens up a SEP period for you, you have to provide proof of that SEP.
So what does SBI stand for?
SEP verification issue.
So we're doing an acronym of an acronym?
Yes.
What crackhead came up with that?
I don't know. Someone at CMS. Is this being recorded?
And what's a DMI?
A DMI is a data matching issue, so that's where if you are putting information on the application that doesn't match the government systems. I know. So there is reporting in the platform that helps you keep track of these, and they're very important that you are keeping track of DMIs and SBIs.
If someone is slow in getting back to you, and for some reason they don't get it to you until 31 days or 32 days, do you gotta redo everything at that point? Or can it be put in and they'll backdate it, or
I
is there
don't
an
have an answer to
appeal?
that. I think you'd probably have to do an appeal, but we'll have to follow up on that.
They usually give you a date when documentation needs to be submitted.
Correct. Yeah, so you'll see that date.
Don't do it by then they will take away the subsidy.
Correct.
And they can still get it, but they won't get it until.
Correct. Yeah, so with a DMI, they lose subsidy eligibility. With an SBI, the carrier never gets the enrollment file, so the policy would not go into place.
So what happens when they do upload the stuff to Health Sherpa and it takes 2 months for anything to be done and you have to go in and resubmit it? It's been done like 4 times and it shows the original submission date, but it takes 2 months for it to get approved.
CMS appeal right there.
Does it?
Yeah, that's okay.
So this says processing, that's not.
Correct, yeah, and you can always contact our team and we can look to see if there's anything we can do with CMS. I know one of the other things, just to muddy the water some more, is that previously, well, up until this open enrollment, you could use what's called a double redirect. Is anyone familiar with what that term means in here? Yeah, so through an EDE entity, you could get backdoor access to healthcare.gov. So you could use a double redirect to get into the marketplace application. And I know that's how you could technically go in and try to re-upload documentation. CMS is removing the ability to do that this year. So my assumption would be if you had a document stuck in a pending status, you'd probably need to reach out to them and find out what's going on or if they needed something else. So, yeah, there's a lot of red tape this year. Any other questions on DMIs, SBIs?
So am I understanding you right that they are expecting us to collect people's tax returns and documentation and hold that and keep that on file?
No, you're not required to keep that on file. We're recommending that you can collect documentation from them. So if you generate, an SBI is different. That's, if they've got a qualifying life event, that's one thing. You'll need documentation for that.
Like a termination of recovery group.
Exactly. Yep, exactly. Or an attestation. But income would probably be something to be a good habit to start collecting proof of income. Just so that if there is a discrepancy between what the marketplace is getting through the IRS system and what they've put on their application. If there's a discrepancy, that's what generates the DMI. So if you have the documentation, then you can just resolve it a little bit faster.
Okay, but in this day of privacy and everything like that, how wise is it for us to be collecting income verification information for our clients and holding on to it?
Store it on Health Sherpa and let that be our problem.
Okay.
Yeah. You should not put it in a file cabinet.
Don't, okay.
Yeah. I'm not recommending that.
Okay.
But I
could sell it though.
You can request it through Health Sherpa through an email or a text message, but I talk to a lot of agents and agencies that are requesting it through text message and then they're emailing it to themselves and then they're storing it on their desktop and You probably don't want, all of that on your computer,
That's
so
kind
we're
of a
giving you a
nightmare to
secure
think
way.
about.
Yeah, exactly.
There's also a link in the health server, but they can send the link to the customer, and the customer
Yeah.
can upload it.
Upload it.
Yeah, we'll talk about that.
They can upload it directly.
Okay, you're smarter than that.
There's been a lot of
You're
new
younger
features.
than I.
There's been a lot of new features this year, so definitely sit in on a training with our team, or we're happy to do a custom one for this group here, but lots of new features, lots to learn. The biggest thing that I've been sharing, talking to agents and agencies this year, is that you have to start OEP prep a lot sooner this year because there's going to be more to be done. So we've built tools for you to review your book of business. We've built renewal factors so you can look at things across your book to understand where you have to prioritize. So for example, we know Aetna's leaving. You're gonna wanna prioritize your Aetna book and make sure you've got a plan for those clients. You need to start consumer outreach early. So if you're not contacting your clients already, you need to let them know there are some additional changes this year and it's going to likely take a little bit more work through open enrollment. So to be either scheduling an appointment with you come open enrollment, or expect your phone call or your team's phone calls. We've built out a consent library, so on that same topic of, should you be storing things on your computer, we've built the ability to collect consent outside of the application and the ability to store that on HealthSherpa. So you can do that any time of the year. You can collect that initial consent that you have the consumer's authority to work on their behalf. You can do that in the platform. Updated information early, talked a little bit about that. I'll show you the slide in a minute. Compare plans with your clients ahead of time. So one of the questions I've been asked quite frequently is, when will the 2026 rates be live? Well, it depends on how many times the carriers have to file them, and we don't have an answer to that. I do not envy the carrier team, so for all of you that are dealing with changing rates, I'm sorry. But typically, window shopping will open up a week prior to open enrollment. The way that this works is CMS releases what's called PUF files, public use files, to HealthSherpa, and then they tell us when we can turn that on. So in the 6 or 7 OEPs I've been at HealthSherpa, I think the longest one we had was like 10 days prior. It's typically a week prior. So expect the week before open enrollment, you'll be able to see the 26 plan rates. And this is a really great time for you to be able to start comparing plans for your clients, see what sort of changes that they might be expecting. We've built functionality, I'll show you, of a side-by-side plan comparison, so it's really easy to see what sort of changes they might be facing. You can leverage our renewal risk factors to prioritize who needs to be actively renewed. So obviously, a lot of things are on the horizon. If the advanced premium tax credits are not extended, that's going to have a much greater impact across your whole book. So you're going to be needing to prioritize probably those who have the change from 0 to now a premium, those with the biggest changes, maybe over 400%. So lots of filters that you can use in the platform to prioritize accordingly. And then lastly, renew consumers quickly with Turbo Renew. So Turbo Renew is an internal HealthSherpa name, but it's our terminology for our renewal functionality, where previously you would be able to see in your renewal 2 of the 6 sections would be a summary section, so that all you have to do is review that summary section, and then if everything looks correct, you just proceed to the next. We've requested from CMS the ability for all 6 sections of the application to be that summary section. So if your client doesn't have changes, it's literally like review the summary, move on to the next, review the summary, move on to the next. And before all of this invalid action stuff that came out last year, the average renewal would take about 4 minutes. So our goal is always keeping the renewals as quick as possible.
So you're saying you're gonna have that active?
If CMS approves it, we do already have the Turbo Renew functionality in the platform, but every year we're trying to make it faster and faster. Yeah?
You mentioned a couple times, like filtering your database.
Yeah.
Like at over 400% or the other 150%. Can you tell me where we get that?
Yeah, I've got a slide on that. I'll show it to you in just a minute here. Yeah, lots of new functionality and lots of places to look around this year. Any other questions? Okay, so we'll start with the renewals tab. So does anybody in here have an agency account? Because it operates a little bit differently than an agent account. Okay, so from within the agency account, if you're on the agency tab on the left navigation, there's a renewals tab up top. So you've got That at the agency level, if you don't have an agency, the screen that I'm showing here is on the clients on the left navigation pane. And then, I'm sorry, the screenshot is not the best, but you can see renewals up top. So you've got client follow-ups and then renewals. Both of these get you to similar places, but this is where you're gonna go to start filtering out your book of business. So one of the renewal follow-ups that you can look for is, let's say, carrier exit, if you wanna look for Aetna, or if you wanna look at income near 400%. You can find this list in the renewals tab or the client follow-ups, and if you can see here, you can export this out. So if you wanted to do like an email or text campaign, you can pull out a contact list there. If you click action, it'll just bring you right into that client profile. And then if you're running an agency, we're gonna give you agency level renewal insights. So you're gonna be able to see across all of your agents what sort of risk you have. So it's gonna track active renewals, what % of your book has carrier exits, and then as you're working those renewals, we'll keep track of that for you. Anyone have questions on this functionality here?
Did you say text campaign or did you say email?
Either. So you can't do that. Well, you can do some of that through HealthSherpa. So if you're using a CRM, I don't know if Agent Boost gives you a CRM, you can export out your contact list through here. So it'll give you name, phone number, and email, I believe, and you can export it on the specific risk. So let's say you do Aetna as the risk. You could have one text campaign through your CRM that says, hey, Aetna's leaving the market, please contact me so we can review your 26 plan. And we are, I think we launched it either yesterday or the day before, giving you the ability to do bulk email sends as well in the platform. Eventually text will come next, but you can do a lot of this through our bulk email functionality. Okay, so some of the renewal factors that are available in the platform. So we're gonna flag if somebody has a $0 premium. These things may change as well as new risks come up as we approach open enrollment. Tax return access denied, so if CMS is not getting access to the IRS documents that they need. A carrier change, so if we anticipate that the client is being crosswalked into a new carrier, we'll flag that. Carrier exit is what it says it is. And failure to reconcile APTC is indicating that the client did not reconcile their premium tax credits. The intake form is something that we launched in the last week. This one's really exciting. So what this does is an intake form where you can collect changes from your clients. You can send this out in bulk. We will give you the ability to text this. We're working on some additional reporting where you can pull this out and self-serve as well, but this is what it looks like here. It does not pull their data from the existing application. CMS makes that really difficult to do, but what you can do is send this out to your clients and say, please let me know if you've had any changes this year. So let's say their income changed from $25,000 to $35,000. If they fill that out in this intake form, when you're doing your renewal, we're gonna show you in the application right next to the application that there was an income change. So the point is making that very obvious that there's a section that you have to update there. They can also upload documentation through here, indicate if their household size has changed. They can put notes in here. We're looking at potentially allowing consent in here. So we'll make some iterations on this. We've been working with Heather and the team here on some feedback for this. So this one we're really excited about. Any questions on the intake? Yes.
So I know there's several ways to do it, but I can see like on the Medicare side, I keep track of my new business on my Excel spreadsheet and then downloading that occasionally onto our CRM here at Agent Boost to update it. What if I'm not actually enrolling the person on the tool and adding new people on the tool using the tool, but can I go from a spreadsheet with all the right columns and everything and load their information in, a group of them?
You can do it in bulk. I mean, if you're importing clients that already have marketplace coverage, as long as you have the right data fields, you can do that. Trying to think of, help me understand an example of when you would be, so you've got people on a
Well,
spreadsheet and you're wanting to get them on
maybe
Health
just
Sherpa?
start with this. I've got, like hundreds of clients that are on my Excel spreadsheet that I've used for years
Mhm.
and have not used Health Sherpa. I mean, just on a few occasions.
Okay.
Can I take that spreadsheet and upload it into Health Sherpa?
You can, yeah.
And then will it need a bunch of changes and fixing the spreadsheet so that it will upload properly?
Maybe, so if you go into the client tab here, when you click clients on the left-hand side, above where it would say all clients, where you see your client table, there's gonna be a button that says import. If you click on that button, it'll show you the template that you need to use for that. And the template will tell you which columns are required to import. If you don't have all of that data that's required, it will not be successful. The alternative around that would be you use the search marketplace link and you have to add them one at a time. All you'll need for that is their first name, last name, state, and zip code. And that is something that, you know, you could add as you process their renewal. The benefit of that is if they have existing marketplace coverage, we'll pull all of that information in for you. So when you go to do their renewal, it'll all be pre-filled and you'll just have to update anything that's changed. Yeah.
Questions. Do the plans, like our existing plans, auto renewal? I know it's not good practice, but do they?
They should. So they have the ability in the application, there's a question that asks if they would like to be auto-renewed in their subsidy, and that's whether or not the subsidy renews year over year. Generally, they would be passively renewed. I think there are some risks of, you know, whether or not that carrier is still available, if they're crosswalked into the same plan with the same network. The piece to know about is that the way that the crosswalks work is it's typically done in a couple of different batches and it's done between the carriers and CMS, and so we don't have visibility into that. So if you've had clients passively renew, you likely know that they do not appear in Health Sherpa automatically, so you'll have to use that search marketplace button.
1% of our members did meet their deductible. However, that does include the plans that have a $0 deductible, so they meet those right away from day one. So let's talk about a couple of the changes. First one up here is the Benchmark Platinum Standardized Plan. We're just increasing the maximum out of pocket from $43 to $5,200. And then for the Benchmark Gold Standardized, we're just adjusting the maximum out of pocket and the medical deductible up from $78 to $82, and then $1,500 to $2,000. Best slider here. Let's talk about the silver plans, the most popular plans that we offer. So quite a bit of changes here. Again, mainly focused towards the out-of-pocket max and the deductibles, but there are some co-pays that we had to increase in order to fit within that AV calculator range, and I'll go through those quickly. So Benchmark Silver Standardized just increased out-of-pocket and deductible. Silver 3000, same thing. We did increase the minor X-ray benefit from 20 to 50. A couple other changes here for the Silver 5900 and Silver 3000. However, you will see on a couple of our plans here, one thing I wanted to highlight here. One of the ways that we were able to get around this AV calculation, or fit within the range they required, is we've actually separated on some of our plans the benefit for minor lab and the benefit for minor X-ray. Okay, we found that not a lot of our members use the X-ray copay, and so since we separated it and we made the copay a little bit higher, it allowed us to fit within that required template. Okay, so it shouldn't impact your members a ton. If they do have to go get an X-ray, they'll be looking at a $50 copay versus the 15 or the 20. But again, it was a required change and hopefully doesn't impact membership too bad. Let's talk about the CSR changes now. Again, we just have some updates to the maximum out of pocket and maximum deductibles for a lot of these plans. But the Silver 3000, we did have to hit with a couple other increases on their copays, such as the specialist office visit, urgent care, minor X-ray, and a little adjustment to the pharmacy deductible there. This is the most important slide here, Silver 5900. This is the marketplace. If you ride on the marketplace and people are qualifying for those CSRs, this is the plan you're typically riding. We did have to increase a variety of the copays here so that the member has a little bit more responsibility, okay, especially when it comes for that 94% CSR plan. In 2025, a member that was on the 94% CSR would see 0 across the board for a lot of their copays. We're just increasing those slightly for 2026. So you'll now see a $5 copay for PCPs, $15 for specialists, $5 for minor lab and X-ray, $115 for major diagnostics, and $10 for outpatient rehab. Okay, so not huge increases, but remember that's used to paying nothing. You know, this could be a pretty big change to them. Our bronze plans, our expanded bronze standardized plan, we're just increasing the out-of-pocket there. But our benchmark expanded bronze copay plan, we did have to increase and change one benefit here. The biggest change here is for 2025, if you had an inpatient hospital stay, you were used to paying $2,950 per day up to a 3-day maximum, okay? That has been changed in 2026 instead to a 50% co-insurance. Mathematically, it's still relatively similar, right? But it is going to be a change versus from a copay going to a co-insurance, right? And so, still a necessary change that we had to do. Okay, go ahead.
Sorry. Do the RX deductibles accumulators allow for the brand name copay cards to track?
We'll go over that. We have a pharmacy section here, and so we have a lot of great benefits for pharmacy. It's a great question. So stop getting ahead. No, I'm just kidding. Perfect. So this has been mentioned, I'm sure, a ton of times today. Our bronze plans are now HSA eligible. So the biggest distinction here is it does not matter what the benefits are on your bronze plan. As long as they are a bronze tiered plan, they will qualify for HSA status. We are honoring this both on and off exchange. Okay, so all of our bronze plans across the board will be HSA eligible. We do have some benchmark benefit changes. So now, as of January 1, 2026, we will cover CPAP and BiPAP machines. My goodness, no more mid-year calls from your members saying, hey, I need a CPAP. You know, how's that going to be covered? So this is awesome. That'll be covered on every single plan that we offer. We've also got some coverage for crutches, knee orthosis, and circumcision for anyone that needs it. It's never too late. This is a busy slide, my goodness. You know, those plan spreads. Who was around, man, a couple years ago when these things would take up almost your whole, we call them the dinner mats, right, or whatever, the place mats. They are huge, so. This is still kind of a rough draft. Our agent seminars are happening next week. We should have official copies ready for you guys, and you should be able to order these and have them printed and shipped to you shortly within the broker portal. Okay. I've just highlighted here our 3 most popular plans. So that's going to be the Benchmark Expanded Bronze Select Copay Plan. People love it. The Benchmark Silver 5900, and then the Gold 1500. So our 3 most popular plans within their respective medical tiers. Ooh, man, this is my favorite slide. Average rate increases. Where are we at? Select Health right at the top. Average rate increase of 12.8%. Okay, which I know you never want to see a rate increase, but it sure feels good to have the lowest rate increase in the state, I'll tell you that. This can change depending on where you're at. We're seeing anywhere from 7% to 18% depending geographically specifically.
Is Washington County like 39%?
Not this year. We avoided that bullet, so last year was a rough one. But yeah, we just have some modest rate increases in Washington. We're not trying to relive through that again. Let's talk about our grandmother plans. They're here to stay, all right? We're having an average rate increase of 5%, and there's no benefit changes. The only thing that we've really updated is rate changes due to birthday won't happen until renewal, okay? So this was such a pain when you'd have a birthday mid-year, your rate would increase. Now we're just bringing it in line with our other products, and their birthday should not update until they actually renew for the next year. Okay, quick overview of our networks. There's no changes for any of these. I just wanted to go over them briefly, but we'll have our signature network, which is available in Utah, Salt Lake, Davis, and Weber. Great low-cost affordable option for people that live in that area. Our value network plan, along the Wasatch Front. We now officially have more enrollees on the value network than the med network, so definitely the most popular option by far. And then we have our Select Health Med plan. This is great for somebody that wants comprehensive coverage throughout the entire state. You guys know this, okay? I just want to go over it, just in case anyone's new, or they're like me and they need it written down or else they'll forget. So open enrollment begins November 1. The deadline for all January 1 is going to be December 15th. Anything that's submitted after December 15th up until January 15th will have a February 1st effective date. Great change right here. Our short-term plans are now extended up to 364 days. So, yes, we really wanted to make this change in anticipation, right, with kind of what's going to happen with the APTC and stuff this year. So you can now enroll in these at any time throughout the year, and we are offering renewals for up to 2 years. So these are renewable essentially 2 times for 3 years total. They are still kind of those transition plans that you're used to, just kind of accident, injury, more designed to be short term, right? But we are looking at adding additional benefits, but you know, that's on the docket for the future.
Is cost going to stay where it is now?
Yes, yeah, cost is down. The only change we've made to this is that we've extended the time frame.
And it can be renewed. Does it have to be qualified at renewal? Or is it automatic qualification renewed?
It should be automatic qualification for renewal. However, you know, like pre-existing conditions and stuff like that would still apply.
But if they, let's say that you had a client who was on a plan, fell off his roof and broke his back.
Yeah.
The next year, he doesn't have to qualify based on that broken back. He won't qualify.
No, there's a small list of health questions, right, that they would have to answer, but it's not going to be, necessarily fully medically underwritten.
Okay.
Select Health Dental. It's all right. We're working on making it better for you guys. We're working on it. But one of the big changes we have is that dental can now be added at any time throughout the year in Link, okay? So, yeah, no more having to have an SEP or something like that. You can just go into the portal. If they want to add Select Health Dental, they can do that and have
This
it next.
kid might need orthodontia.
Yeah, that's nice.
Just saying.
All right, so that's a lot of my updates. I just wanted to talk about a couple of tools for success that you might have. We want you to have a super successful open enrollment, and we want to make it as painless as possible. So I wanted to talk quickly about your BOB, your Book of Business report, Marketplace awaiting binder payment report, the plan spread, plan change sheets, and then some member materials that you can order. In the member portal, if you navigate to the member search/maintenance section, you'll see a huge button in there that's nice, big, and purple that says download book right here. And so once you hit that, as long as you're November 1st or later, you'll see a new section in your Book of Business that will talk about the renewal plan, renewal premium, renewal APTC, and renewal adjusted premium. Okay, so you should be able to see that. We populate it immediately as soon as we get the renewal information from healthcare.gov. And so I would highly recommend once November 1st comes around, download your Book of Business, see what your members are moving to. Does anyone have a crazy premium? You know, can we re-verify income on the marketplace? This is a great place to do it. So. One other thing I'd recommend is bookmarking this page. You can bookmark it every time you log into our broker portal. This will be the first thing that you see. Okay. For some reason, on default, it's set to group, and you know we'll get that changed. Don't worry. Some other great resources here. If you hover over the Agent Tools section in Link, this is where you'll find a bunch of your different reports. Your non-payment report. Children turning 26 is awesome, right? On the individual ACA market. Children turning 26 can now go to the end of the year. So open enrollment is a great time to run this report and say, hey, who turned 26? Let's make sure they get re-enrolled right in the next year. So, did you have a question?
Yeah, so in the past they've done like $20 a month if you exercise and show that on the program. So 2 questions. Number 1, are you going to have that again this year? And number 2, if you are, is there a way to like send that out to all your clients so they know? Because I found out about it in like October after I'd had it for 9 months.
Oh yeah.
It's like, oh, this is awesome.
Yeah. Maybe we did that on purpose. No, I'm just kidding.
Right.
Yeah. Stop getting ahead, man. Everyone's getting ahead and asking questions. I got slides on here, just be patient. So, agent resources, great tab. Okay, if you click on that, you'll see all of the different resources that we offer for agents. The best thing I want to pull out here is any flyer or form that you see that has a truck next to it means that it's orderable. Okay, and so I'd highly recommend you go in there as soon as those new plan spreads or whatever you want to hand out to your clients are ready. Order those, get them shipped to you. We provide that to you at no cost, so you shouldn't have to pay for shipping, material costs, anything like that. Okay, get those shipped so that you have them on hand if you ever want to use them for your open enrollment meetings or give them out to clients. So. All right, let's talk about some member benefits and services. So first of all, our member services department is the best, the GOAT. If you ever have any insurance plan questions or questions about how your benefits are going to work, they are the experts. Okay. Next, we have our member advocates department. They are specifically, trained in helping members find a doctor that's in network, and also they can schedule first-time visits for your members, so they make it super easy and painless to go see a doctor. Additionally, maybe they're a little bit younger, they don't like talking on the phone. They can log into their selecthealth.org account and just chat with somebody securely, okay, through like a secure IM or instant messenger. This is what their member portal looks like. I'd highly recommend they get this set up. They're able to see their ID cards, claims, EOBs, year-to-date accumulators, right? A lot of great stuff in here. You had mentioned wellness rewards. This is where they will sign up for the wellness resources and physical activity reimbursements. There's also some sections in here about your pharmacy benefits as well. And we'll kind of talk about how those pharmacy benefits are changing and kind of what we're offering. In their member portal, if they click Find Care and then Drug Lookup, this is the screen that they will see. So they'll see their pharmacy benefits right away. They'll be able to see their spending related to pharmacy. They'll be able to see a couple of different options here that we provide at no additional cost. And then these two at the bottom that I want to highlight is Mark Cuban's Cost Plus Drug Pharmacy and Amazon RX Pass. Okay, so we'll go over those quickly. This is the RX Saving Solutions tool. Your members can enroll in this, and essentially what it is a program that will help your members find medications at potentially a lower cost. Okay, so they look up the cost in different pharmacies. You can even clip some good RX coupons, right, and use them at different pharmacies. So it's a great tool. I'd highly recommend that you encourage them to enroll in it. And let's talk about Mark Cuban's Cost Plus Drugs. If they use this link here and they're able to find their medications, we will credit whatever they pay on Mark Cuban's Cost Plus Drugs towards their deductibles or copays, whatever they're paying for. We want that counted towards their medical benefits. So you can often find a lot of drugs at a more affordable price using Mark Cuban's Cost Plus Drug. Also the same thing as Amazon RX Pass. We don't pay for the Amazon RX Pass membership. They do have to be an Amazon Prime member, and there is an additional $5 fee. But I've been able to use it. It's great. They ship medications right to your house, and we credit that all towards your medical benefits. Super, super great benefit. We also have our virtual care options. So these are going to be like your Intermountain Connect care, right? This is available 365 days a year, 24/7. $0 copay on all of our individual plans. Okay, so typically they're able to treat 85% of people that use the Connect Care app. I got a quick story with this. My son was having an allergic reaction to something. I pulled up the Connect Care app, showed the doctor, the rash, kind of explained what was going on. He wrote me a prescription. We went to the pharmacy, and I gave it to him probably in about 45 minutes. It was awesome. And then he was so much better the next day, right? So.
Does that work for mental health therapy too?
Right here, we also have a mental health therapy option for you.
I said it before I saw the new screen.
Yeah, that's right. That's right. We're connected or something. The wavelength.
Slides.
That's right. Are you a spy? This is not available 24/7. They do have to schedule an appointment. They're open from 7 a.m. to 7 p.m., but it is a virtual mental health, behavioral health option. Also available at no cost, which is great. They can go through a bunch of different providers, so if they're not, vibing with the person they connect with, they can connect with another one and another one until they find a provider that can really help. Let's talk about wellness rewards. You do have to sign up for this, okay? You're not automatically enrolled. So this is a great opportunity after open enrollment's over to reach out to your clients. Say, hey, did you enroll in the Wellness Rewards benefit, right? The more times that you can interact with your client throughout the year, I like to think the better open enrollment you're gonna have. But the benefit is the same. We're gonna reimburse up to $240 per person or up to $580 per family per calendar year. And you can qualify for this in a variety of ways. If you have a gym membership, if you take 7,000 steps a day for at least 20 days out of the month. We've also added some cool other benefits such as yoga, Tai Chi, karate class, and acupuncture. So super great. I'm not going to demonstrate any Tai Chi, but I highly recommend you go do it. It's pretty cool. Signing up for the Wellness Rewards also gives them access to the Sworkit app. Let's say they're more of an at-home workout type person. The Sworkit app is awesome. Once they create their Wellness Rewards account, they'll be able to download the Sworkit app and use that same login to be able to be paired with a trainer, like an online physical trainer, or look at different training plans. It's super nice. It's just your online app where you can see a bunch of different workouts that you can do at home.
That's available on all the plans?
Correct, yeah. As long as they're signed up for the Wellness Rewards, then they'll be able to use that same login to download the Sworkit app.
And to sign up for Wellness Rewards, they log into their online account?
Yes. Yes, a lot of accounts getting logged into, but yeah, they log into their member portal, and then they go down to their Wellness Rewards, they create a Wellness Rewards account, and then that's how they get access to everything else. I just want to call attention to our member discounts. We do offer member discounts for LASIK, gym memberships, hearing aids. You know, we get VASA memberships, EOS memberships, whichever one you're more privy to. So super great benefits for them just for being members. And so yeah, that was my spiel, man. I just want to, my final slide here. Man, we've been in the business for 40 years, but I want to say it's only possible because of you guys. So thank you so much for your membership and your partnership that we've been able to have. So this growth would not be possible without you guys. So give yourself a round of applause. Thank you so much for just keeping the market happy and sustainable. So I really appreciate it. So if you have any questions, please come by the booth. We'll still be here for a little bit after, but until then, I'm going to pass it off to the lovely Jordan Larrabee, who's going to tell you about all about small employer plans.
Did Alex just call me lovely?
Yes.
Is that the word he used?
Yeah.
Strange choice, but I'll take it. Thanks for having me, guys. I've been with Select Health for a little over 4 years now. Some of you have probably seen me before. What did I do the first time you saw me? Medicare. I'm not doing that anymore. So, my point is, if I can do it, so can you. So I'm small employer sales now. Kind of the point of me being here today, curious, anybody here do anything with group plans currently? A couple people, maybe a little bit here and there. So I'm not talking about product today. My point is to show you how easy and simple it is to write a group plan. To hopefully get you looking at that. There is potential for a lot of shakeup in the ACA market with APTCs, and group plans are a great alternative to that if they are small business owners. So, first thing, what is a small employer group? First thing, size, small as 2 people, including like a husband and wife group. So say husband and wife run a company together, they're both on payroll, qualifies as a small group. We'll go all the way up to 50 eligible employees, and there's different nuances and rules that you may not be familiar with. One of them is contributions. It's a 50% requirement that the employer pays 50% of the premium, and the employee can pay the remainder 50%, and then anything over 50% they're welcome to pay if they want to. Participation guidelines for the super small groups, they have to have 100% participation. They are allowed to have valid waivers. So say they have employees that have a marketplace plan, maybe they have coverage for their parents, something like that. They don't count towards that. This is only for people who are eligible for the plan that we're taking into consideration here. So what you need to quote a small group, super straightforward. We need the company zip code to know where they're domiciled, because they're rated based off of where they're located. The effective date, we can quote out up to 3 months in advance. an enrollment census that includes at a bare minimum the date of birth of the employees, state they live in, and first and last name. That's it. If you've got those, we can get you rates to be able to present to them to see if it's a better fit versus another option they may be looking at. So I'm going to run through that process. You can time me. I promise this is how fast it is. This is not sugar-coated to make it seem like it's super quick. It is super quick. So you go to our portal. Under the group drop-down, it does default to group. We're not changing that, Alex. You go to get a quote, and then you select the plan type. So small employer is what it defaults to. Put in the zip code, employer name, small employer is amazing. And then the date you would like the coverage to begin. And then the next is the census. So there's a couple different ways you can go about this. If you just have the information, just click on add an employee. Just fill it out. Add their information on the portal. Other is upload census. This is if the employer group sends you a census of their employees. You just format it, upload it in there, you're done. If you already have some employees added here, but they need to add more, you can download it, it's formatted the way we want it, and you can edit it from there. Here's an example of a census. This is not my example. I don't love flowers as much as this person does, but this is as straightforward as it is. You can see the thing I want to point out across the very top, the red categories are the required categories. So just those 4 that I went over earlier, if you have that information, we can build you a quote. So here's what it'll look like after it's built out. We'll have it all loaded here down at the bottom. If you can see that, it lists how many members, how many employees. And it's going to say, hey, you're saying everybody's taking medical, are you sure? It's going to pop up. Don't panic. Yes. You can click yes. And then you go through, select the plans. These little radio buttons over here on the side, that's how you select the plan. For the quoting process, you can select as many as you want. For actually enrolling, we only want you to offer 3 generally, but I can be flexible on that. Just let me know if they really want to offer more. And then after that, you're done. You have that quote reports button down there in the bottom. And you'll have enrollment summaries that show you who's taking the plan, what their cost is, and then the rate report, which will break down cost by plan. So it'll give you all the variations and variables of how much it will charge them. Present that to your group that they're looking at. Once they decide that they want to take it because it's such a great plan, you just click on continue to enrollment. You have an option to do electronic enrollments, or you can do paper enrollments, or you can do enrollments right through a link where it sends out URLs. I don't recommend that, but it is an option. You can see here's kind of like a breakdown what it will look like, and it gives you the full range down here. So depending on what they select, it could be anywhere in that range. Next is the group application. This is just what the group has to fill out as an employer group. Mostly just demographic stuff for the business as a whole. So actually onboarding the group. So they say that they want the plan. Next, they have to be onboarded. We have a team of service coordinators who help you through that process. If you feel like that's too much, don't worry. I promise my team will take care of you, and they'll make sure that everything is all set up correctly. So you can see all these bullets, wage and tax or articles of incorporation are needed, applications and supplemental forms, waivers for any employees who are not selecting the plan, the group application, which is the one we went over a couple slides ago, and then an e-check is the preferred method for that first month's payment, and then just a couple deadlines to be aware of. The group application and enrollment needs to be submitted before the effective date. So if they want October 1st, you have until September 30th to get everything submitted to us. And then after that point, if everything's submitted, we still have kind of like a 10-day buffer to get everything finalized. You can do that by the 10th, and then we'll still give them that October 1 effective date in that example. This little flyer here is available on the agent resources section that Alex showed you earlier. This is a great tool you can send to those clients to say, hey, make sure that you have this stuff available and make the transition go a lot smoother. So a couple value adds. Same stuff that Alex covered earlier is also included with group. They get the wellness reward, they get Connect Care, they get RX savings solutions, all those great things. This is something that is unique to small group. So they actually get included at no cost to them. A company called Mineral HR. They are a human resource / compliance service to help those small employer groups navigate the compliance world. They can build handbooks, they can give legal and expert advice, provide trainings, so many things. Their services, depending on the size of the group, can save small employers thousands of dollars a year. It's included with their health plan at no cost. It's another thing that sometimes that type of thing falls back on you as the broker, the producer. We'll ask you those questions. You don't have to be that expert or that resource because we have that built in for you. So commissions. Somebody asked about doubling commissions earlier. Easiest way to do that is to write group. So and this is actually just based off of this year. We're doing another bump. It'll be $42 per employee per month starting January 2026.
So it doesn't count family members?
It does not.
They have spouse and children.
Yeah, just the
If they
employee.
have like 10 kids, it's $40.
Correct. Yeah.
And you don't need the family on the census. Do you need all the family members as well?
Yes, we want everybody who's going to be enrolling, just for the most accurate numbers. Yeah. Okay. If you have any other questions, I don't have any materials. Again, today was just kind of introduce you to the group world. If you're interested in it, come visit me at the table. I'll be here for a little bit. And if you want product stuff, I can send that over to you.
Question. One real quick question for me.
Okay.
Okay. Yeah, you run a business with 2 employees.
Yep.
There's a guy, the owner, and his assistant.
Okay.
The assistant quits, gets fired. There's only 1 employee now. What will happen?
Depending on the time of year, we won't allow them to renew.
Okay.
But there's a secret time of year where we won't care. We'll talk about that if you get to that point later. Okay. So thanks for listening, everybody. Appreciate it. I'm going to turn the time over to Jason to cover the really exciting stuff.
Okay, this one? Yep. So someone over here has the slides already? Is that what I'm seeing? Perfect. So we'll make this quick. And I noticed that I'm the last guy between you and the door. So, are we all from Utah? I understand this is a national thing, possibly, right? Okay. If you were at our Utah seminar last year, this will be a repeat. I was asked to present the same information, but we can expand a little bit. So yeah, we'll just jump into it. So the Special Investigations Unit, not sure if you've ever heard of an SIU at a carrier before, but my team in particular, we've got a lot of different backgrounds. We kind of come from everywhere, but what we do is we investigate leads of fraud, waste, and abuse. So fraud, we like to throw the F word around a lot, fraud. And, but to be fraud, we'll actually get into the definitions here in a second, but what a lot of people call fraud is not actually fraud. But first, before we get into it though, I will say that this information I'm going to present, it's a kind of a case study, and I'm not going to get into any names. I'm not going to get into facility names. Some of you may know, but we're not going to go there just out of respect for everyone involved. And our purpose also isn't to make you think, oh, the SIU is like watching me. We are, but we have a lot of data. We have so much data, and so my purpose is to help you guys be more successful, which, as Alex was saying, is what is a cornerstone of our success at Select Health, right? So we want to help you help us, if you will. Okay, let's define fraud though. What are some words that you think would fall in the definition of fraud? Intentional. Intentional. Okay, we're done. You got the slides too. So this is a very wordy definition of fraud. Knowingly and willfully, so intentionally doing some act, okay, to get something you're not entitled to. So now we're gonna pull it back to abuse. You can read this if you want. Basically, it's very similar to fraud, but it's without the intent. So I'll give you 2 examples. I want to get onto an individual policy with 0 deductible, 0 premiums, and problem is I make, let's say, $250,000 a year. But I have a friend who's a broker, and this broker knows what to enter into the system to get me that policy that I want. I'm guessing you've probably had people approach you and say, hey, help me get a really cheap plan. And you're like, I know too much. I know what you make, you know. So, but that buddy of mine enrolls me on the policy. At, you know, it's a full cost share, 0 premium. That would be fraud. That would be intentionally misrepresenting information. Now, let's say I approach a broker who doesn't know me, and I get the same policy because I know what to tell the broker. From the broker perspective, the broker would not likely be liable for the misinformation because they entered what they were told. They did not intentionally misrepresent. But in the end, I still got the same policy. So the overall impact of fraud and abuse can look exactly the same, but it's very different as far as the outcome with the person that misrepresented the information. Does that make sense? Mm-hmm. Okay. That was a really bad example. All right, let's move on. Okay. So in our space, it's estimated that 3 to 10% is lost to fraud, waste, and abuse. And so the last good year of information we have is 2023. I think it was about $4.9 trillion spent on healthcare goods. And so if we go 3% of that, it's a giant number. But I want to show you, I want to just paint the picture at Select Health, because that's the data that I have access to. So far this year, we've averaged $16.7 million a day in claims payments. Okay, and if we're at 3% fraud, we're looking at $503,000 a day. Now, we don't think we're at 3% because we're Utah. And we don't have dishonest people in Utah.
Right, that was proven today.
That was proven today, yeah. Well, yeah.
No one's ever.
No, we really don't, like, we're not in one of the, if you were to look at a heat map of fraud, Utah is not red, Utah is not even orange, okay? But we do have fraud here. I can promise you we do have fraud here. We find plenty of it. So, but that's a lot of money. But whose money is it though? It's your money. It's my money, right? All of us pay into the system somehow. This is Medicaid, so those are our tax dollars. It's Medicare, tax dollars. The fraud that I'm going to show you today, there's a lot of premium dollars that were taken. And those premium dollars were not paid by the individual, they were subsidized premium dollars, which is what? Our taxes. So we're all really victims of this. Okay, so we're going to talk about substance abuse disorder, some substance abuse facilities, and then some broker interaction that kind of created this situation. So first, I'm going to back up clear to 2018. We had a facility that was enrolling people. They were taking them off of Medicaid and then putting them on the marketplace because they were not a Medicaid provider for us. And they were just helping people sign up online, just as anyone can do. Get on healthcare.gov and sign up. But then they were also signing some people up without their knowledge, which was really interesting. Anyway, we investigated that, we took care of it, and then the industry started talking here in Utah, the facilities. They're like, okay, that was a bold move, that was risky. So how do we mitigate that risk? Well, here's a room full of people that we can shift that risk to, is basically how they saw it. So fast forward to 2023, we started seeing some really crazy trends in cost at these facilities. And so my team started digging in to the data. And what we ended up finding was we had 8 facilities that were really standouts in almost all their population, all their patients were ACA members. and all of those were fully subsidized ACA plans. Most of them started right as they started treatment. So you all know how open enrollment works. Enrolling 400 people in August for a single agent is a really weird thing. Would you agree? Yeah. Well, we were seeing it. So we took about 900 policies and audited them, and half of them came back as being enrolled using false information. The information that was false was not only the income, but also there's a question on the application that asks, do you have any other coverage? Specifically Medicaid is where this case kind of sits. We actually have access to, it's called PRISM. I don't know if you've heard of it. It's a state, it does a lot of things with Medicaid, but we have access to the eligibility part of PRISM. So we can see if a person has Medicaid through Molina Healthcare or Healthy You or us. I mean, but we could see, in our data, we could see that anyway. But anyway, we found 450 policies that had Medicaid. They were enrolled as if they didn't have Medicaid. They were enrolled in fully subsidized plans, which is a no-no if you are on another government plan. And ultimately, there's a $14.8 million loss to Select Health. So you might think you're helping a person out by getting them on a plan, but if it's not accurate, what could end up happening is that plan could be rescinded, and then the person's left with all the medical bills. But then $14.8 million, and that was just in the medical claims. That doesn't include all the premiums. That doesn't include any commissions that went out for those to those brokers for those 450 people.
Did those commissions get collected back?
No.
Well,
no. In the end, there were a couple broker contracts terminated with Select Health, and then a couple of the facility contracts were terminated with Select Health. And this is actually something that continues. We had some more of this activity this year that we worked on. And so it's something that we monitor and just continue to try to crack down on it. It's really hard. And it's really hard for you guys as brokers. And I'm going to actually kind of share some thoughts on how we can avoid something like this. Because I do know that you are kind of at the mercy of the information you're given. I understand that. But if most of your book of business falls in this category, then I would say it's fair to say there's a problem. So that's when my team gets involved. We will contact you, we will have the conversations and try to understand what the story is behind the data. Well, we know what the story is that the data is telling us. We want to talk to you to see if that matches with what we're thinking is happening. But some things to be aware of. If you're in Utah, now other states, how many here are from another state? Okay, perfect. I'm not talking to you right now. Actually, I mean I am. But in Utah, we have this thing called targeted adult Medicaid. When you leave jail or prison, most of the time you're given Medicaid for a full year. And I just found out today that Select Health is going to be covering 10. So anyway, so targeted adult Medicaid. If you got somebody that just came out of jail, and they're looking for insurance, talk to them about targeted adult Medicaid. Are you sure you don't have it? PRISM tool. This is the tool I was telling you about with eligibility. We are trying so hard to get you guys access to PRISM because we know that it would be just amazing for you to have. I'm sorry to say that I actually said the same thing last September. We started the push to get PRISM eligibility, like access to brokers, and here I am a year later, and I'm telling you, you don't have access yet, but we're still trying. So, but when you're talking to your client,
what's the reason that we don't have it? Is there a reason?
Are these recording? Okay. PRISM has had some issues. And the state, I think they've been troubleshooting a lot of these issues. And so number one, I think it's just a priority issue. And number two, we're trying to get the right people to catch the same vision that we have with it. And so that's what we're trying to work through. Great question though. I want it so bad for you guys. So ask more probing questions when you're asking about, hey, what's your income? Do you have any other coverage? You know, you just came out of jail. Are you sure you don't have any other coverage? There's this thing called targeted adult Medicaid. Just really make sure you've gone all the lengths to make sure that your information is accurate. Record your conversations. This is really helpful because when my team or you know, Melina's, are they in individual this year, next year? No. All right. Well, when someone else's team or my team comes to talk to you about what they're seeing in the data, it's super helpful for you to be able to say, you know what, I actually have that phone call recorded. Let's take a listen. Or you know, whatever it might be, but you want to be able to protect yourself in with the information that you've entered, that you've got really good, accurate records. Take really good notes. We actually did talk to a broker in this case that was like, hey, I've got all these notes, and while their enrollment did kind of fit the trend that we were concerned about, they were able to show us that they really tried. Maybe, like I would argue, maybe we could have gone a little further, but that's kind of hindsight's 20/20, right? But we were able to just talk with the broker. Okay, let's try doing this next time, and it you know, it was just it was really nice to see all these notes. If you ever have a clinic that says, hey, let's partner, and you get the membership, and then for my patients, like, that's weird and probably not going to end really well. You just have to wonder what the motivation is there. And then another thing you want to be careful about is that there are no kickbacks. There are no incentive payments for you from that clinic or facility to enroll these people. That would be highly illegal. Most of the time though, the clinics want this so that they get more reimbursement. That's really what it's all about. And then, of course, brokers might be more interested because they get that double $40 a person. That's cool. Okay, sorry, that was small blur. But you know, some might be looking at it from a commission perspective. But just make sure the information you're entering is accurate. Be able to show that you went to great lengths to make sure that it was accurate. Let's see. Yeah, and then if you have anything that you would like to talk to us about, there's a lot of ways to contact us. Questions? Was that fast enough?
You were good.
Okay. Are we planning on going to the Utah seminars? Okay. We're going to be presenting some other stuff there. You know that there's a lot of changes with the marketplace next year. A lot of the areas that we've been struggling with from a fraud, waste, and abuse standpoint a lot of this stuff is going to be kind of fixed by some of these changes. We're going to talk a little bit about that. But yeah, appreciate you guys. Really, my message, I'm like the fun sucker generally, because like, you know, we're like, yeah, sell all these plans, and then Jason comes along and says, hey, stop doing that thing. We really do want you to be as successful as possible, but we want to make sure that all of it is above board, and we don't want your business interrupted. We don't want Select Health to lose another $14.8 million in a scheme like this. So we're all in this together, really. So thank you.
Thank you again, Jason. There's no way to follow up with him, but the only thing I wanted to do, the only thing that can really follow Jason Bailey is reading off the raffle prize winner. So let's do that real quick. If you guys are here, go ahead and raise your hand. We have 4 raffle prizes. First one here, Barbara Finton. Woo, nice. Tyler Moore. Woo! Nice, gotcha. Ann Watson.
She left.
Oh, there we go, right in the back. Nice.
There she is.
Angela Olsen. Angela Olsen.
Can we get it?
Let's do it. Get it for her. Woo! Congratulations, winners. Lady Luck is on your side.
females.
Come by the table, get your prize. First come, first serve. So go.
Appreciate Select Help. Dan Hartle is going to close us out with a few messages, information. We're going to send you home.
Wow, this is really a sad group at this point. Jason was wrong. He was not the last guy between you and the door. It was me. So, sorry, Jason. I gotta outdo you a little bit there. No, I do feel bad. I appreciate you all hanging with us. We saw this group kind of dwindle throughout the last 2 days here at the very end. So, since we have a smaller group, I want to mix it up a little bit, and I want a little bit more interaction from you all. Okay, try to keep you awake for the next 10-15 minutes before I send you on your way, and hopefully you can beat traffic a little bit. All right, deal? Yeah. So again, going back to interaction, I just kind of want to ask the group what you've been sitting here for 2 days, listening to a lot of different carriers. You've been listening to staff members. We've been talking about AEP. We've been talking about OE. What are some of the takeaways? What are some of the themes that you have noticed from the last 2 days? Anybody? Anybody brave?
Disruption can be good, but it's really scary.
Disruption, yep, a lot of disruption.
Great opportunities.
Opportunity.
We need to be much more diverse to be Medicare, FCA, and
Being dynamic, absolutely.
I'm gonna try being the kiss up here. Agent Boost is really awesome.
All right, I'll pay you $20 later, Chief.
Nobody else does this.
I
Nobody else does this. Agent Boost is awesome, and there's the only way to put it. So thank you.
He won a prize last night. You already got. You got University of Utah.
I got University of Utah. That is not a prize.
I made my night. All right, but hey, one thing I will say, you will find me a little cheesy. I do quote expressions. And one of the things, if you've ever gone upstairs on our second floor and you're walking by the bathroom, I have an entire wall of quotes up there that I picked and I put up on that wall because they mean something to me. One of them up there says, opportunities are often disguised as hard work, so most people don't recognize them, right? And that is one of the things up on the wall right upstairs. And I would tell you that is exactly what this OE and this AEP is shaping up to be. It is a lot of opportunity and it is going to be hard work, right? And most people aren't going to see it. It's going to look pretty negative. It's going to look pretty rough. It's going to look rocky. And it's right there. It's there for the taking, all that disruption and opportunity. It's like we always say to agents, listen, it's like mining for gold. It's in the mountain. Go get your pick. Go get it. You have to go get it. You know it's there. Go pick up the axe and go do the work. It is the exact same thing. It's always been there. So I also think, why did some of you get into the insurance industry? You could have done a lot of things, right? I thought I wanted to be a dentist when I was growing up for a hot minute. And then I decided I hated the smell and the sight of blood, right? It wasn't for me. But why did you become an insurance agent? Did anybody get into the business because you want to make money? Yeah. How many of you got into the insurance business because you found out, you heard there's a lot of millionaires in the insurance business and a lot of people make a lot of money that way? One person, okay, JT. Another couple said, all right, good. I want to be a millionaire, right? Who else wants to be a millionaire? Right? Most of us in the room. That's why we're doing it. There's more millionaires that are made in the insurance industry and real estate than any other industries, right? Historically. Now, the money's still there. And the reason I'm bringing this up is because we've been talking about all the bad things